Good afternoon, everybody. I hereby call the City Council Emergency Special Meeting of April the 2nd, 2020 to order at 3:05. Madam Clerk, please take the roll.
Councilwoman Morgan.
Yes, ma'am.
Councilman Carvelli.
Present.
Mayor Orvac.
Present.
Vice Mayor Martin.
Here, ma'am.
Councilwoman Carballa.
Here, ma'am.
Next on the agenda is the pledge, but I'd ask that we rise and that Ms. Phillips, you go ahead and give us an invocation, and then we'll follow that with the pledge.
Almighty God in heaven, we ask thy blessings upon those gathered here this afternoon and upon all the citizens of Port St. Lucie. Look with favor on our leaders and give them the insights, the wisdom, and the patience to deal with the problems and tasks coming before them. Bless their work and their deliberations. Amen.
We need that more than ever. Amen. And now the pledge. I pledge
Allegiance to the flag of the United States of America.
States of America, and to the republic for which it stands,
one nation, under God,
under God, indivisible,
liberty and justice for all.
for all.
Good afternoon, everyone, and thank you for attending, whether you're here in person, out in the lobby, or on the World Wide Web, participating responsibly and at a sufficient distance. Today's meeting is going to be about the status report of where we're at in our fight against COVID-19. It's also going to be an in-depth discussion led by our city manager on our response and recovery plan. Additionally, another item that was anticipated, and a lot has happened since this meeting was called, is with regards to a safer at home order. So since the call originally went out, both the county and the governor have now answered, and the governor's clarification today, the answer to that is that his order supersedes all local orders. Is that correct, Mr. Stokes?
That is correct.
So he has unified Florida under one order, and we're going to talk about what that means, given that that order refers to the federal guidance on essential, critical infrastructure workforce, and also Miami-Dade's order that's also incorporated. So both of those, I believe, and Mr. Stokes will inform us later, both of those are controlling, and you want to know what that means for you and your family and your businesses and your community, and we're going to try to help all of us get through that and make sure we do the very best we can. Before I go further with my opening comments, I want to take this moment to really, I think, drive this home and to again express our deepest condolences to two of the members of our team who lost their aunt already to COVID-19. So when you look at the deaths that are occurring in our country, well, in our world, country, state, and county, understand that that can hit very close to home. It can impact all of us and has already impacted two of our beloved team members, longtime team members here at City Hall. So again, we give them our greatest sympathies. We want them to know that we are here for them in their time of need in the difficult days and months ahead. We want to also be there for our community. I think at this point, because so many citizens are staying home, they understand what COVID-19 is, and many of you understand why it's a threat, but it's just important to reinforce that COVID-19 threatens our society and our way of life because it can make us very sick. Now, most of us, 80% of us, will have our symptoms resolved, but for a significant portion of our population, it can send you to the hospital and sadly kill you. And when those deaths, we've seen now, and the point's going to be made online and everywhere else, that anyone can die from this. And sadly, we've seen a baby die, we've seen healthy young people die, but most of the people who are most impacted are elderly and those who have underlying conditions. We often call them immunocompromised. Now, in addition to the direct threat to health, the rate of infection, the rate of spread has the potential to overwhelm our medical system, and you've been watching that probably on the news every single day. It can shut down essential services because too many people could be out sick. It can disrupt all aspects of life, including the food and essential goods supply chain, and it's already contracting the world, national, state, and local economies and interrupting all social activities. So this is a big deal. These are grave threats, And in response to that, all levels of government are working as hard as they can in the response. And also, we look forward to the day when we can get through this fight to the other side, to where the recovery begins. And with that as an introduction, Council, do you want to make any introductory remarks before I turn to the city manager on the situation report?
No, sir.
Councilwoman?
No, sir.
No.
Vice Mayor?
No.
Council
Not now.
persons on the World Wide Web?
Not now.
Okay.
No.
Thank you. Mr. Manager.
Yes, thank you, Mr. Mayor, members of council from afar, Councilmember Carvelli and Councilmember Morgan. This is our second very unusual council meeting, and I'm reminded of a fortune cookie proverb I've seen, may you be fortunate to live in interesting times. Now, there have been times through this, the last couple of weeks when I would say not so much, yeah, but reality is that that we are all dealing with the worldwide pandemic with COVID-19, and your city government has gone into action quickly with a declaration of a local state of emergency. Mr. Mayor, did you have a question before?
Do you mind if we just have some interplay? Would you
Sure.
mind if I just interject? I just want to ground our discussion and our community consideration, and it's your staff, but you know, it's our team also. So you're the commander, you're the executive, but we work together as a team, and you often tell the mayor and council, your employees, even though they're your employees, you embrace it as a team. And I'm calling on you and our team to ground ourselves and our community, our citizens, to ground ourselves in special points of empathy. You know, we have more than 45,000 seniors and an undetermined number of immunocompromised and PSL who are at substantive risk of hospitalization and death. These citizens have heard the messaging that we're at war with an invisible enemy that can kill them if they go out in public, visit their grandchildren, or touch a contaminated surface. That's pretty scary and can trigger a fight or flight response. And we can't wonder or be surprised if people are stressed out and worried. So we have to make sure that we try to walk in their shoes. No one working for the city is likely to go without a paycheck anytime in the foreseeable future, unless, unfortunately, you were a part-time or contractual employee, and I think we're going to have a conversation about how we might get them reemployed, helping with this response effort. But a great number of our citizens are already out of work and can't get through the hotline to file for unemployment. It doesn't take long if you live paycheck to paycheck to go through your savings account and wonder how you're going to buy food, let alone pay rent. Many of our retirees have lost a significant portion of their retirement plan as a result of the fluctuations in the market. They might be worried about living out the rest of their lives, how they're going to do it. Healthcare professionals, first responders, our police department, our essential employees here at City Hall, none of these hardworking heroes can stay home. They worry about getting sick, they worry about their families, and have to see the death, despair, and panic play out firsthand. Try walking in their shoes and remember the stress that they and their families are under. Support them in any way that you can. The people working at the grocery store, pharmacy, gas station, takeout kitchen, they're all being exposed and doing their job, a job we need them to do, a job that the governor has declared essential for close to minimum wage. They have the same worries too. And parents and families are locked in their homes together with none of the usual breaks for school, work, and play. And if we really think about these things, I hope it motivates our team to ask the fundamental question for our reason for being in public service: how can we help? That's our job. How can we help? This is when we have to be at our best. This is why we're here. Let's answer the call and find the best ways to help our people. And I hope, Mr. Manager, that you're going to help Port St. Lucie set the standard for getting through this emergency. Thank you, sir.
Yes, thank you, Mr. Mayor. Well, I'd like to give the council and our community an update on what we've been doing to preserve your vital services first, our essential services. On the 17th of March, we declared and you affirmed a local state of emergency. Since that time, we're doing a lot of things differently. So the very next day, we restricted our services to online, mail, telephone, no in-person services. Now that sounds like we're lowering our services. We were increasing them because we're doing the city's work, providing services in a way that we are less likely to have the potential to contaminate our citizens or to have impacts to our employees. And it's actually been very successful. We've seen, particularly with our utilities, but with our building department, I'll go through some of those successes. All of our services are available and they're being accessed readily online, in some cases with phone calls and others. So we did suspend utility shutoffs. As we know, this was a very sudden stop in the economy. Many folks are laid off, and more probably to follow, unfortunately. And we did not feel like that we should be looking at our utility system in the way we would normally have looked at it. I believe that is consistent with the actions of our surrounding municipalities and FP&L. So we quickly made a number of changes to our services. So all based on the principles that were enumerated by the CDC. First, if you're sick, don't come to work. If you feel bad, don't come in and share that with your fellow employees or your citizens. Second, look at the idea of social distancing. Don't meet in larger groups of above 10 or more, and keep a distance between each other. So we've been following those services, very strongly, and the CDC guidelines. So some of our services historically are difficult to provide using those guidelines. So an early decision was that we would restrict the use of our parks, that we would suspend or cancel our programs. Many of the concerts we had planned on were canceled because they were time specific. The good services we normally provide, whether it's Zumba or chair yoga, they're all very difficult to provide those services using the CDC guidelines. So we suspended until further notice all of those services. Our Minsky Gym, which is a great asset for our community, but it's often...
Do you want us to ask questions during your presentation, or you want us to wait till the end?
Mr. Mayor, I probably will answer your question going through.
Okay.
But if any council member feels like you really want to amplify, please, let me know, and I will. But I do have a number of actions that your city government has taken.
Thank you.
So I was mentioning Minsky Gym. That is a very crucial service, but we often have 100 or more kids either playing basketball or watching. And we cannot, under that circumstance, allow that kind of activity to occur because it violates the gathering principles from the CDC. So we did close the Minsky Gym for those larger groups. We ultimately closed our playgrounds. We started out with our playgrounds open, but we quickly saw that as other activities have declined, we had more and more moms and dads bringing their children, and we were beginning to exceed the gathering numbers. And so we felt like that because they generally are not staffed, we felt like we could not continue to have our playgrounds open. We closed our city boat ramps to all use except for commercial boat ramps or commercial boats, and that is consistent with the state direction. So our parks, though, are open, and that's important. You can go for a walk. You can ride your bike. You can go for a picnic with your family. So the parks are open, But we have instructed our staff, we have instructed our police officers to be there to help if the staff cannot get compliance, that we as an organization want our parks to be open, but we want to ensure that we're following through with the CDC guidelines. And it is our profound and sincere hope that our citizens will help to keep our parks open by following the CDC guidelines. So we have worked to change the way we do business. So I mentioned early on that we discontinued those in-person services. So if you previously would come in to pay your utility bill at the counter, you would go into the building department to get a building permit. We felt like those services could be provided online. We have actually found that they not only can they be, but we're actually more efficient and more productive. As an example, we moved our utility customer service group, which is a group of 12 employees. We outfitted with each of those employees with a laptop. In some cases, we've increased the bandwidth at their house so that they can answer all the calls that they used to answer in the office. They're now going, they're following the same number, but they go right to their home. And these employees are working out of their home. Now, the very interesting thing is we're actually seeing our call time, how long you're on the line waiting before you get to interact with customer service representative, is actually down. So our utility customer service employees are actually more productive. We're helping people, and have actually been able to reduce the wait time on the call, which we feel is a really good indicator that things are working and that we can deliver our services effectively, but in a very different way. So another thing that we've done, and this was authorized by state statute last year, but very few building departments had been taking advantage of it, and I want to compliment Mr. Dramus. We are allowing inspections where the inspection is in an occupied structure. You can use FaceTime or Skype to actually show the work that's been done. Let's assume it was an air conditioner technician replacing a compressor. They're able to show how it's hooked up using FaceTime, Skype, and we're able to issue approvals and permits using those remote tools. And it's worked out extremely well. It allows our employees to be safe, but allows commerce to continue. As the council is aware, the mayor's aware, from the meeting of the 23rd, we changed the way our public meetings are held. We've now held a council meeting. We've held a site plan review committee. The site plan review committee was all virtual, went very smoothly. We have a plan board meeting coming up soon where we will have all of the plan board members online. We will still allow, if there is demand, in-person attendance in the room, similar as you see today where people are separated by at least 6 feet. But we have plans and ways that we can continue to do business. I think we were one of the first local governments in the region to actually be able to show that you could have a council meeting, an effective meeting, and do it following the CDC guidelines. So each day, your staff starts out with a phone call, all the departments. We talk about what's happened yesterday, overnight, what we're hearing from the Emergency Operations Center of the state and the county, and then we provide information on each department. What are the issues that are impacting us? Do we need policy guidance? Are there any changes that we need to be able to enact to ensure that our services are going forward and provided in a high level of quality and efficiency? So a couple of things to think about. So we typically have done as many as 500 permits in a day, inspections in a day. it's still, we're now averaging about 430 inspections a day. So we're just a little bit off our average, and we've had some days where we exceed our average number of inspections. Permits are down, but we are still issuing many permits for new construction. And indeed, last Friday, we issued 19 new single-family permits. So the important part of that statement is that the commerce in Port St. Lucie is continuing, and your city government is helping to be a vital part of that commerce continuing. So we have worked very hard, and your communications department has done a very good job on providing information to the community. Our website is very robust. We have a COVID-19 button on the very top, or banner on the top of our website now. When you click on that banner, it takes you to a whole laundry list of issues, everything from closures or changes in our base services to business resources. And so all of the information that we've been provided on from the state, from the federal government, about loans, about grant programs that might help businesses to weather this very uncertain time. It's all right there, along with contact points for all of those individuals. We are working and should have in place tomorrow, particularly for the Paycheck Act. We should have not only the banks that are participating, which are already up online, but the names of people who you would want to contact, their phone numbers. And Mr. Wooten has been helping people as well, and we're also directing them to the Small Business Assistance Center, really working very hard to ensure that our businesses, which are vital because we employ so many people in small businesses in Port St. Lucie, that we're doing our part to make sure they have resources and assistance. Mr. Wooten has actually provided, where he can, assistance, and here's how you fill that out. It was the kind of questions or information you want to provide. There are multiple loan programs, including the Paycheck Act, which is a forgivable loan, which is being administered by the Small Business Development Center, but lots of information, but not enough information on it at this point. And so we'll be working to continue to have all that information available on our website to get you to the right institution and the right person where appropriate. So we've assisted our residents that are looking for supplies. We've been making calls every day to find out which businesses have vital supplies. We're posting that information on our website, including information on senior hours. As the council is aware, many businesses have instituted senior hours, in some cases senior days, and we provide that information on our website. So we're doing many things differently. Some were tools we already had, and we didn't use that much. The Microsoft Teams, when you turn your computer on, that pops up right away, and many employees and the council are probably automatically members of Teams. And so prior to this event, we really had not used Teams very much, but now we're very familiar with it because we're working to be remote to make sure that we are safe in the way we do business, both for our employees and for our citizens. So you've come into the building here yesterday and today, you probably see far fewer people. We are working to ensure that, one, some functions should work remote, and I gave you the example of the utilities customer service. Second, some employees may need to work remote, and then in some cases, it's really more convenient just in order to reduce the number of people in our building. So as of today, we have over 160 employees working remote. They are working based on a policy that was adopted. They sign an agreement as to how they'll use their equipment, how they'll communicate with their supervisor, and we're measuring how can we be productive and ensure that our taxpayers continue to get value from the employee in the position. So a bigger question is, I believe we are managing the event very well. There's a question of what will we do for recovery? So the county EOC, which the city participates on regularly, has been coordinating resources, looking forward to when the event slows down and we're back into recovery mode. The city is looking at what resources may be needed, how would we distribute those resources. A good example that I do want to make you aware of is because of the potential shortage of beds for our hospitals, we have been in discussions with the county EOC, which is they're working with the state health department as to whether there is a location on the event center grounds or rooms in the event center where we make for alternative hospital beds. Certainly not at this meeting, but if you want to talk to me individually about that, your thoughts on that. But it's the one large facility in Port St. Lucie where we may have overflow hospital beds. We hope that it never gets to that, but I would like for you to know we're thinking about that issue and how would we provide additional beds in our community. We also we've had people reach out to us from the community. An individual offered that they may have 50 beds available in former addiction treatment center, and we've shared that information with the state EOC. So at a more micro level, we're increasing our sanitation, our disinfection of our city facilities. You'll see more frequent cleaning. We have upped the amount of cleanings we do. We're using everywhere you look, you should find a readily accessible hand washer that would allow you to sanitize after coming in and out of buildings. So we're doing what we can to prevent the spread of COVID-19. I had a question regarding our continuity of operation plans, and again, a portion of that is recovery. Some of our continuity operation plans are not available to the public because the services that are provided by the city fall under the auspices of the Homeland Security, and so we don't make those available. However, I want to relay to the council that we are meeting with each department, have been meeting since January, with each department to go through their continuity of operation plan. What are what's your line of succession if somebody should get sick, should not be able to come to work? How do we follow on all of our vital services? And we have a plan for all of those services. We're continuing to refine it because, in truth, the nature of this emergency changes almost daily. Mr. Mayor, I will pause there. After some questions, I would like to go through, if you're agreeable, just some of the highlights of the governor's declaration yesterday of a safer at home, and certainly I will rely on Mr. Stokes when we get too deep into the what does this mean issue.
Thank you, Mr. Manager. I want to take that as item 4B, and I would still say that that'll be a whole separate item as it relates to the Safer at Home order. Right now, though, as part of the situation report and update on the city's response and recovery plan, I have a number of questions and comments and actually calls on you and hopefully our council for action. But first, Vice Mayor, anything? Councilwoman?
Mayor, Mr. Manager, I would just like you to briefly speak about the communication piece to the public in general. For example, we are continuing business with residential homes and contracting, et cetera. What measures is the city taking to ensure that the public as well as the workers are informed? Or if someone has a question, how can they learn more through our abilities?
So we're using all the tools we have. So we're certainly putting information on our internet site, our website, hourly. Anything changes, we update that website. We're certainly out on TV 20. We have done a number of Facebook Lives, and we'll be doing even more as we kind of go deeper into what will be a long-term event. We would hope that people will watch your council meetings, but also watch these Facebook Lives. Daily, I've been putting out a situation report that provides information to the council, but that's a public document. We also make that available to the media and to the public through our website. So we do have a lot of essential businesses that continue to operate. And as we're going forward, and you'll hear more about the Safer at Home that identifies essential businesses, but we'll be doing everything we can to post that on our website, show what is essential businesses. There are questions that people have about, well, is my business essential? The governor's order and the corollary additional orders that were previously identified and the Miami-Dade list of essential businesses is a very good starting point. And so we're trying to get that information out. I think we're, for a city that's not the center of the market, we've done a lot, and we're going to even do more.
My follow-up question to that, too, is that when it comes to businesses that are essential, we know they'll be continuing to operate. Non-essential businesses are being mandated to close according to the order. What is the city doing for the recovery piece? What are we planning on? Who are we working with? What are we partnering with to help individuals understand what they can hopefully look forward to with the different packages that the federal government and the state government has provided? What are we doing to get that information out and help coordinate that for the public?
Yeah, we provided everything that's out there now, between the federal government and the states with the links to every one of the agencies. Tried to summarize what some of those programs are at a high level. Obviously, there are in some cases many pages, and have the links to all of that information. Also for businesses, I've tasked Mr. Wooten, our business navigator, to be available to answer questions, help guide somebody, navigate them to the right location where they can get the information. So there's a bridge loan that's available from the SBA. I'm told there are many, many applications already, but we can get them to the SBA, our local SBA. The local Economic Development Council is also serving as a resource, and in there, I believe, maybe bringing in other folks to help to answer some of those specific questions. But the council, I believe, is aware, and I think most of our public should be aware, the stimulus act that was passed by our federal Congress and Senate last week is extensive, provides a higher level of unemployment and compensation for folks that may be unemployed, addresses a number of different issues and programs at the federal level. And many of those we're not the experts on, but we are good at letting people know where do you go to find all the information.
So for me,
and it's all on our website.
One of the things that I would like to work on is to organize a small business task force. And whether, I know those players are already around, we have the EDC, but I would like something more formal as far as like a small business task force that we can begin to organize in the future. And this is a long-standing pandemic that we'll be dealing with. So it's not going to happen overnight, and I understand that, and nor is the response going to happen overnight. But I would like to start seeing the ability for us to organize the information. It's disheartening to hear that we're not getting, our citizens are having challenges with unemployment, challenges with being able to get access to the services that are being provided by the state and federal level. So having that business task force organized with all the resources and being able to do that outreach whenever possible. And like I said, I know we have those people today. It's just a matter of making sure that they're focused on the COVID-19 piece of it. Thank you.
Mr. Mayor and council members, no, there is a business recovery coordination team that's been meeting regularly. Certainly the tools that they can use have just become available in the last 4 work days. But it includes your navigator. As needs come along, we may expand, and help, provide more resources to that team. The EDC, Fort Pierce, the county, the Small Business Development Center, the St. Lucie County Chamber of Commerce, and Career Source. So that team is meeting regularly by phone. They have a plan that they'll be announcing, I think, tomorrow, on how they will help businesses to access more loans and grants. And, because it's not my team, I don't want to say what they're going to be doing, but we should be listening to exactly what they're going to be doing. We'll be in some cases leading, in other cases we'll be supporting.
Well, that was a soft way of me saying that I believe Mr. Wooten's going to probably need help, and so I'm supportive
Yes.
of that whenever it's available. Thank you.
Thank you.
Thank you, and I'd love to hear from the Vice Mayor, Councilman Morgan, and Dr. Carvelli on this. But yesterday, Mr. Blackburn came into my office and said, Mayor, we got an update for tomorrow, but it might not go as far as you want it to. Mr. Blackburn, this does not go as far as it wants to. I want to. Councilwoman Carballo has provided a warm-up. I'm going to go much stronger than that. Vice Mayor?
I just kind of piggyback on Councilwoman Caraballo's comment with regard to the unemployment website being down. I've seen it myself. I was trying to assist my mother-in-law with her claim, unemployment claim. It literally took me over 2 hours because the system keeps booting you out and you got to keep going back in. Some people it's taken a lot longer, but I did see today that the state is now going to allow people who are having trouble to do paper applications, so that they can get the actual forms from the website, print them off, and be able to send them in. So I think that could be helpful for some people. And I also saw a post from Representative Overdorf about if people are having problems that they can call his office. So maybe we can provide that information on our website as well, so that his office will be assisting people as well with the unemployment issue. I'll have more comments, but I think that gets into the 4B, so I'll wait for that time.
Okay.
'Cause I know you want to keep things systematic.
Just, I think that's going to be an all-encompassing conversation. We should break it out.
Sure.
So to your point of getting people connected with help on unemployment, one of my thoughts is that it's one thing to refer people to 50 websites when they're already overloaded with information, and it's another thing to guide our community. Let me go. Dr. Carvelli, are you out there? Do you want to make any comments at this point?
I do. I'd like to make a comment. I've been in these viral situations, often in schools, and if you notice, the schools were some of the first to react and send people home. The reason for that is you want to keep your workforce healthy. In maintaining essential services, which is our primary mission, and giving good water, sewer, law enforcement, our employees have to stay healthy. And separation was critical. I was talking about that to you early, Mr. Blackburn. You did it. And that is critical if there was to be an outbreak in the building or among a certain labor force inside the organization, then we'd have all kinds of problems. We wouldn't be talking about recovery methods and recovery down the road. We'd be just in more of a survival mode. So appreciate you doing that. I've spoken to a number of businesses, taken personal protection myself, been in the drugstores. They put up plastic shields. They're doing one customer at a time. Drive-through operations. They're handling stuff to you that you could wipe down. The supply chain seems to be breaking down among the smaller businesses, Elijah, like Walgreens, CVS. Walmart is getting product. Obviously, it's the toilet paper, hand sanitizer, wipes, all the stuff that soaps that people wanted to grab. So they seem to be getting a supply, but some of the smaller chains are not. So that's something that if we could help by getting our legislators involved. This is a team effort. There's no lone rangers here. I'm not a lone ranger. I'm not going to be one. But this is just bringing facts back to the team. And if we could get people involved who can help, that's how we're going to do very well at the end of this crisis. But thanks for your comments so far, Mr. Blackburn. I'll have more at the end.
Thank you, sir. Councilman Morgan?
could probably wait until later, but on what Councilwoman Caraballo was saying, there's so many out there already for the small businesses. I think it would dilute it by duplicating so much. And I did talk with Pete Tesh today. I know the chamber, I see it everywhere, Facebook. And if we have the links on our website, and it's just sharing it and getting the word out. But as far as like another small business task force, I think it's diluting it when we already have the experts working it. And I know Elijah's working with the EDC and the chamber. So I think that's great.
Thank you, ma'am. Well, I do think there's an opportunity to reconcile what you're saying and what Councilwoman Caraballo is saying, and I would ask you to think, when the governor issued the order and that order became available online to everyone and everyone could find it, does that mean everyone understood it? And so there's linking people to resources, and then there's connecting people to resources and helping them understand it. And I'm going to continue to call on all of us to do a better job at that. And if you've ever been part of City University, you know that sometimes I talk about what a city is. And I think on one hand, a city is a place. It's a location on a map. On another, it's a municipal corporation. I mean, it's a city, it's a municipal corporation. So it's a going concern. And Mr. Manager, I think today you did an excellent job of sharing with us that we continue to be a going concern, and we're taking all actions necessary as a business to continue our very, very essential business. So I really do appreciate that, and you putting everyone's minds at ease that we're doing everything we can as a corporation to get through this and continue to provide our essential services to the public. I think that you and Mr. Snyder did a good job with your anticipated financial impacts to alert us to some of the things that you're doing very prudently from a financial perspective to continue. And I think, you know, whether you call it a municipal corporation or when you refer to the word city and you're talking about City Hall and the organization and the team of city employees, the public employees, that's another thing that city means. But I think the most powerful use of the word city is when you're referring to our community as a whole, a group of people working hard, smart, and together on our strategic plan for the future, which is to be a safe, beautiful, and prosperous city for all people. That plan is on hold or has been commandeered to deal with a crisis. And as much as Dr. Carvelli and others have dealt with viruses, no one has dealt with a pandemic like this since 1918. And I'm not aware of anyone currently on our team that had personal experience with the Spanish flu.
Mr. Mayor, I want to state unequivocally I was not here then.
No, you were not, sir. You weren't even in Martin County at that point. So given that our most powerful term of city, or the most powerful meaning of city, is all of us coming together, I'm asking for all of us to come together and pitch in and to do more than, oh, well, only this part is my job. So I would call on us to designate, if there's already a great group working on small business and unemployment, well, let's designate them our group and our official point of referral to guide our residents, and let's get updates from them on a regular basis. Let us create a mental health and counseling team, Mr. Manager, an essential business and essential activities team that answers those questions, or in the words of Mr. Stokes, directs them to the order where they can read it for themselves. But please, we have to do more than link our public to 50 different web pages that are opaque, meaning they cannot see through them, they cannot understand them. They do not, at this, especially this time of worry, fear, and even panic for some, they can't interpret that. And so referring them to a website and saying, here you go, is really not going anywhere at all. So again, working through my list, this is what I'm going to keep hitting you with, Mr. Manager and Council. I want to make sure that we're connecting people with food, medicine, and yes, TP. Dr. Carvelli brought it up, the supply chain. It popped up today. I'm sure it popped up with all the other council members. There's another round of perhaps panic buying going on as a result of this order. What is a good way to connect people with TP wipes, disinfectant wipes, and the things that they need? Can we work with our stores so that you don't have to make 10 trips to 10 different stores to get TP? I mean, when we think about what it means for social interaction, social distancing, do we really want people hunting and gathering 10 times a day if we could work with our retailers on a system where you bought it, you got a rain check, and you came on one day to pick up your order or have it delivered? That seems much better from a public health standpoint. And even though that's not our job, it is our job right now. That's what I would say. We're keeping people connected to utilities, but in the background, Mr. Manager, we need to be working on catch-up provisions, because it's nice that you don't get disconnected during the crisis, but the day the crisis is deemed over by the powers that be, it's really devastating if you have 3 months or 45 days, 90 days of payments to catch up on all at once. Need to advocate for relief on household bills. We need clarification on evictions. We need to provide good direction on mortgages, Freddie and Fannie. If your mortgage is held by Fannie or Freddie, excuse me. I didn't want to aim that at you, even if the elbow was inadequate. That is a negative cough, according to Cleveland Clinic. So if your mortgage is held by Fannie or Freddie, you can ask for help now, but if it's not, I don't think you can, so we may need to advocate there. To your point, there are things that we control, there are things that we can influence, there are things that we can help our citizens ask for. Well, let's do whatever we can, even if it's just asking and advocating. I think that with the CARES Act, going back to Councilman Carballo's point, who's our designated champion? If it's not going to be us directly, let's work with one of our partners. Let's designate them and say, hey, guys, will you be our designated CARES champion? Yes? Okay, great. Can you just provide us updates? Can we refer people to you directly and count on you to take care of our people? Yes? Great. Let's formally coordinate on that. One of the drawbacks to the CARES Act is that some people will have to file a tax return who have never had to file a tax return before. Imagine that. You've never earned enough to file a tax return, but now to get your check, your help check, you need to file taxes. Who likes filing taxes? No one likes filing taxes. It's not fun under the best of circumstances. It's definitely not fun the first time you've ever had to do it and during a pandemic. How can we help them? Can we leverage the counties and the nonprofit groups that are out there that work at libraries during normal tax season? I don't know, but let's figure it out. Small business, thank you for covering that. Helping people connect with personal and family aid. It's so important. I'll just say it again, mental health and counseling team. We have a need to address that inside our team for all the people working hard and seeing death firsthand and having to deal with the stress and having to be exposed and what that means that they can't come home and hug their family at night. And then there's an external to the City Hall team. There's a community need for counseling and good mental health. So who could we work with on that? And this is just during the direct response. I mean, we're not even talking recovery where we could leverage our volunteer force, connect people with employment, coordinate with local partners on restarting the economy. Who are those? Who are those key members? Probably CareerSource, EDC, Chamber, IRSC, and many others. But we need to be thinking about what that framework looks like now so that we can transition when the time comes. Can we create temporary office and field jobs that pay $15 an hour to displaced workers in our community to carry out maybe some of these very things that we're talking about: litter control, beautification, cleanup, fix-up? Are there any opportunities for local stimulus? We've already heard the president and others talk about infrastructure in the community as a way to start the recovery. We've heard the governor say we should take advantage of everyone being off the road with some of our infrastructure projects. Let's make sure that we're taking care of that as well. But those are the things, Mr. Manager, I'm calling on you and I'm calling on us to do. And I really believe that so many of us are already doing that in our individual capacity to the best that we can. I know that this council and that you and your team care about the public and are answering hundreds, if not thousands, of phone calls, social media posts, emails, and just trying to help as many people as possible. But let's formalize our effort and let us not say that it's not our job. Let's find out ways to help our community. How can we help? Vice Mayor?
So I just want to say, I think that, that those things may be really helpful for the people that don't have the access to social media, especially, older individuals that aren't participating on Facebook. I do want to say one of the great things that I have seen, and with the use of social media, specifically Facebook, is that now there's a lot more people on Facebook. And I've been answering, as you have, millions of questions, maybe not millions, but a lot. I mean, nonstop for days and days and days. I answer them to the best I possibly can. And what I've also seen is if someone has a tax question, I've seen people jumping on board saying, hey, I'm this person, I can help you answer this question, call me at this number. I have seen some of that, so that's been really great in the community for people that have specific needs and questions regarding taxes or unemployment. So I think the private sector is really helping a lot with that and getting some questions answers that are really specific to certain professions. So I want to thank everyone who is doing that and participating, because the more that we can help others is, with whatever their needs are is really important. I've seen a lot of great neighbors, especially on Nextdoor, of people saying they couldn't go out. Can you get me TP? Can you get me a pack of chicken or whatever? It's happening. Our neighbors are responding to help their fellow neighbors, and people are reporting that, oh, so-and-so showed up at my door and left me this pack of chicken and the TP and whatever else I needed. So, and I just hope that everyone will continue to do that. But to the extent that we can direct people and connect them with the resources, it's definitely is important to continue doing that. And I know that all 5 of us are going to be doing that from now until this thing ends, and then probably thereafter as well, because it's a lot. People have a lot of questions, and they need to have answers. So, really important.
Thank you, Vice Mayor. And to your point, and I think we return to this concept that continuous improvement is better than delayed perfection. So just getting a little bit better every day. And a lot of us are on social media doing the best that we can to refer people and to really connect with the resources and help them understand in a real way. There's a difference between saying, oh, here's the governor's order at floridagov.com/executive-orders.
Yep.
There's a difference between that and then saying, hey, did you look on page 3 of Miami-Dade County's order, which is now part of the governor's order, and that it says that business is essential? There's a difference.
Absolutely. And so I've spent a lot of time in the last couple of days talking about orders, and especially this one, and then the fact that, it says one thing, but then you have to go through all the amendments and trying to break it down and explain to people exactly what you said on this page. Here's this. You could read it specifically here for yourself, because there's some times where they're asking for my opinion, but I don't want them, I'll give it to them because I don't want them to, have any specific issues with saying, well, Council or Vice Mayor said this, but I have a question about this. I want to be real, make sure that I'm guiding them in the right direction with the language so that they can interpret it the way they need to interpret it. But I think if there's anything that's the most important, and that's about this and making sure we're getting out the right information, is breaking down this summary of what's the essential and what's not, because having been through it several times and looking at everything, I can clearly understand it. I still have to refer back to it, but the more clear we can make it, simplified we can make it, so that our residents understand and we can connect them and say, give the answer, but then if you want to look for yourself, go to this page and look at it. I think one of the other questions that I've been getting a lot, because there's some differences with regard to travel, and people are saying if you go to Palm Beach County and you're an essential service, you're going to be asked for paperwork to show what your business is. I know here we aren't doing that. It's in the documentation, but I've probably gotten that question 10 times between last night and today, about what documentation is Port St. Lucie. If I'm stopped by a police officer, what documentation am I going to have to provide? because Palm Beach County says this. So that's really important. I'm sharing it as much as I can, but that has to be able to get out to people. And then also, I direct them when they ask me about Palm Beach County, who can we specifically direct them to answer that question there? Because if you're talking about direct connection, I'm saying, well, please look on the Palm Beach County website, because I don't have that answer yet, or call the main number, and then they can direct you. But if we can have that connection to be able to give the direct department to contact, that would be helpful.
We'll provide that information.
Mr. Mayor.
Just 1 second, and to your point, because I think that we're really figuring this out as we go here, do we have a master question and answer list? So Mr. Stokes always likes to talk about his listserv, and he's always talking with his buddy attorneys across the state on critical questions. Do we have, through communications, a master question and answer list where we're covering all of these things by topic? So this is intergovernmental coordination, and before we talked about small businesses, and there's just very basic questions. What do you do if you're sick? How do you slow the spread? So if we could have this master list with official answers that we are happy with, they've been verified, they've been validated, it would be great if we all had access to that, so that on one screen we could have it open, and on the other we have Facebook, and we copy and paste, and get, without having to retype. And you know what this is like, because you have a million emails. Mm-hmm. It's so much easier if you're answering the same question to provide.
They all have 50 pages attached to them now, it seems.
Yes. So I really like that, Vice Mayor. Yeah. Councilwoman?
Q&A is important.
Mr. Mayor, I would note to that point, and that's a great idea. We will do that, but we won't do it by ourselves. The League of Cities is doing those Q&As. We may find other local governments, and I think that's where we collaborate and come up with a Port St. Lucie Q&A, recognizing that the Safer at Home was just passed yesterday by the governor. We were working on the county's Safer at Home, and I felt like I had a really good understanding of the county's Safer Act. And then before I could even talk about it hardly, it was the governor superseded that act. And so it has been moving very fast, and there's new information every day. But I do think a Q&A on our website is a great idea. We've been doing that a little bit with our employees, because there are a lot of issues related to your organization. But I think we'll have one also for citizens as a whole.
Well, thank you, sir. So I don't think that imitation is the sincerest form of flattery when it comes to government. I think stealing other people's best practices is the sincerest form of flattery. What I would say is, I know that you're not an epidemiologist, so I'm not asking you to answer public health questions, but many of us, because of all the work we've done, are more skilled at finding information, at understanding information. So it'd be really easy for us to say, on one question and answer master list with different sections by category, by subject matter, what do I do if I'm sick? Well, I'm not asking you to answer that from scratch. I'm asking you to copy and paste and to provide the link to the CDC and what they say. And then now we're in one place answering all the questions and giving the resource to our city council, our team leaders, and our 1PSL operators on how to direct people to the proper sources of information. Councilwoman?
Thank you. Mr. Manager, I just want to, and in case I haven't said this, and I really want to say it publicly, I want to thank you. I want to thank the team. This has not been easy for anybody, especially the people that are behind the scenes and, putting work to action. Like, the mayor noted our first responders, and it's been very difficult. And so I know that sometimes it sounds like, this is a lot of work, and I don't want to make sure that you understand that it's work that we want to work on together. And that's what's really key and important. What I would like to say is that this is going to be around for a while, and we know that we've heard that 100 times. We're going to be dealing with this for the long term. And I hear all the great ideas coming from the mayor and as well as the vice mayor and the other council members on the line. And what I'm wondering is we had to pause our strategic planning session this year. Would you guys think it'd be prudent to potentially maybe have almost a creation of a COVID strategic plan where we take this issue as a city and we have objectives, just as we were speaking, a small business objective, a health objective, a recovery objective. We could even base it on and model on the current objectives of our strategic plan, and then how we're going to deal with it, and whether we're designating different entities to do that. And then that could be our strategic planning session this year, our main one, because this is going to be affecting us for the long term. I think we're going to need a long-term outlook and plan. And I would like to, instead of just, we need you to get a website, we need you to do this, I would really like to just sit down and kind of maybe create how we want to go about that, how we want to implement that, and then talk about strategies and ideas on how we can provide service to the city in this situation. What do you think?
Thank you, ma'am. So we'll see what the rest of the council would say. I would say if you could, and I don't know if you saw it in preparation of this meeting, when you're drinking from a fire hose, it's important not to overdo it and to just keep it direct. And so I put together, for me, and assembling my thoughts, a 2-page white paper, and I had to fight hard to keep it on 2 pages. I would ask that you draft yours, send it to the manager, copy council, and that we have regular updates and situation reports on COVID-19, and that'll give us an opportunity to discuss the ideas as we move along. Vice Mayor?
Yeah, I'm fine with that. My concern is that, you spend a lot of time doing that, coming up with a long-term plan, but things are moving so fast, day to day, things are changing. And so I don't want to get bogged down in something that's so solidified long-term. It takes a long time to actually plan that when we're already been doing this for weeks now, and we're going to continue to do this. And Mr. Manager, your team is going to continue changing things on a daily basis, depending on what happens in, medically, with more testing, with things that may come up that need to be addressed, whatever that is. I mean, I can speculate all day what they are, but we know that this keeps going on every day and we have changes happening. So I think we're doing that. I think our team's doing a good job. I think this continuous improvement to just recognize and keep building on that is really important. But I do think, obviously, like you said, Mr. Manager, we haven't had a pandemic. So we've never had an emergency management plan for a pandemic before. But in speaking to some of our colleagues at the county, now their staff is working on one. So I'm going to assume that our staff's already working on one too. And that is definitely something that in the future, when we do have another special meeting, when things get back to normal, then it'd be great to have a presentation on what that looks like. And then we can fine tune that and have more discussion on what that looks like in the event that this happens again, because it could. Now that this has happened now, we know that none of us would have ever thought this would be, but it could be happen again in another year, 5 years, 10 years, we don't know. So to be able to have a plan for that in the future is really important.
Thank you, ma'am. Dr. Carvelli?
Oh, a couple things. I've been reading a lot, obviously, about what's going on. And like most viral pandemic epidemics, they do tend to cycle around 1 to 2 more times. And the one you mentioned, the 18, they never came up with any vaccine for it. It was so long ago. But now they're seeing this start to surface in the colder climates, the southern hemisphere, colder climates. I think it was Africa, where it's starting to cycle back as a cold weather bug, basically. But I think Ms. Martin hit a very important point, because I was going to mention that before we start developing task forces and teams and operational response plans, we really should look hard as being a partner with the county. I'm going to be very honest with you. We could get way ahead of ourselves, and I know you put a lot of time, Mayor, into your own PowerPoint and a lot of thought. I read all your materials, and then the governor overrode it all with a mass order for the state. So I think Ms. Martin hit a really good point. Let's see what the county's doing. Let's try and partner and keep it very broad, our objectives. So most importantly, keep our people healthy so we can make a response when this ends. Because the prediction I keep hearing now is June, possibly up to August, and a little wave of it ending. And they're measuring it, obviously, and the flu is measured in the deaths per day. And they're looking hard at this. This is very evolving as we go through it. I would like to see our people stay healthy, continue to give our services we give to the community. We've got a lot of separation among the employees, which is good to maintain good health. But Mr. Blackburn, I think we do need to get the framework of a response plan put together with the elements and start filling those elements and see what other folks who've gone through the crisis and are finishing it in areas of the world, what they're doing as they recover. So we can start building the plan as we go, kind of like building the airplane as you fly it. But you want to really kind of start looking into parts of the plan for when the recovery starts.
Thank you, Dr. Carvelli. And to build on your good point, and one that's been shared by the council, I don't think that we have to do everything ourselves, and that we shouldn't. But I do think that we should formally designate who our partners are on areas of expertise or certain subjects. And
I agree.
Yeah, we should absolutely leverage the resources available to us, because it's impossible for us to do everything, whether it's us as individuals or us as a city government and a city team. So we really do need to leverage, but just going back to that point, that there's a difference between saying, here you go, here are 50 resources, 50 websites that explain how you could feed a hungry family, versus, oh, here's a spreadsheet with 50 locations, dates, times, locations, and eligibility, and this one's the closest to you. So there's a difference between saying you're helping someone and actually helping someone, I think. To your point, Dr. Carvelli, you brought up some big picture issues, and at this point, I want to go ahead and transition to just a much smaller PowerPoint presentation, Avi, that I'd like to run through real quick, or anyone who can control that computer. And Dr. Carvelli, you're right that since the call and all that work, the county did answer and the governor answered, but I do think it was important for all the voices across the state, right here in our city, and we also saw it happen across the county. We've seen it happen in other places, other counties, Collier, Lee. They were having these same debates. I do think that was instrumental and important in those voices calling out to the governor and asking him for help with a unifying order. So I do think there was value to the effort, although to your point, there sure was a whole lot of blood, sweat, and tears that the county put into the order, only to have it be superseded, how many days later? 2 days later? I mean,
1 day later.
All right, so if I could, well, it was there and then it disappeared. I hope it wasn't because I disinfected the remote with Clorox. So council, I think transparency and accountability are always very important, and they become more important the more important the issue you're dealing with, and especially in the time of crisis. I think at a time of crisis, the worst thing you can do is not share openly and own kind of the things that are shaping your opinions and your thoughts. It's better just to put it all out there. So that's what I've been trying to do. As you know, I was locked in my house for 19 days. And so if you lock me in my house for 19 days, you're going to get a lot of work. You're going to get some PowerPoint presentations. You're going to get some white papers. You might see me work for 47 hours in a row. We talked about the threats, and everyone here knows those threats. And I made a point of going through them at the beginning of the meeting, so I won't do so again here. But how are those threats playing out? So before we convene this special meeting, the world had 981,000, closing in on 1 million cases and 50,000 dead. The United States, we're at the top of a list that we do not want to be on, because we are the country with the most confirmed cases. We're at 226,374, and 5,316 have sadly passed away. In Florida, we were at 8,010 confirmed cases, 1,058 hospitalizations, and 128 deaths. And right here in St. Lucie County, we were at 47 confirmed cases, 17 hospitalizations, and 2 deaths. And why I put emphasis on 17 is because that's a much higher hospitalization rate than what you're seeing other places. And I don't know if you know, I don't know if that's a reflection of our vulnerable population. We have 45,000 plus seniors. We have an undetermined number of immunocompromised, or it's a reflection that you're only getting tested if you're in the hospital. Either of those things could be true. They could both be partially true, or it could be something else altogether, but it is something that's concerning me. So Florida went, and this is the kind of the sneaky math of this coronavirus. Florida had its first case on March 1st. So in a month, we went from 1 to 8,000. And here in St. Lucie County, we went from our first case on March 21st to 47 today. So what are we at there? We're at 12 days, so not even 2 weeks. We know how we're responding, and we're talking about it at this meeting, but big picture, and Dr. Carvelli was talking about big picture. It's really important that we keep our focus on what we're trying to achieve, and just to reconfirm that with ourselves and stay on the same page. You got to test, isolate, and track. We have to slow the spread or flatten the curve, whatever you like to say better, because we have to lessen the risk to our seniors, immunocompromised, and everyone. We have to avoid hospitalizations that overwhelm our medical system. We have to avoid shutting down our essential services because there are too many people out sick. We want to manage the pandemic until it burns itself out. There's herd immunity developed, and we're still waiting for the good science to confirm that that's a possible scenario. Reliable vaccine and/or treatment. And until that day comes, our go-to tools remain prevention through proper testing and good hygiene and social distancing. That's it. That's our toolbox. Now, here are my concerns as your mayor and your colleague up here, council, and as your mayor of Port St. Lucie. I'm concerned about testing. I'm concerned about PPE. The beds and ventilators are the county's issue. We're not in direct control, but the buck stops with us. And ultimately, in our form of government, as a ceremonial head, the mayor, the buck stops here, and I don't, even though we're a council manager form of government, the buck stops here. I can't give that away. So beds, ventilators, the novelty of this virus for everyone who says that, a lot of people die by the flu, a lot of people die by car accidents. It's true, a lot of people die through those things and cancer. This is a whole new way to die. On top of all the other old ways to die that we grew up learning about, this is a new way to die. And unlike a lot of the ways that we're used to, this is a new way to die that can kill you through no fault of your own. You can't, it's very difficult to take mitigating actions. You can't eat less fatty food. What you have to do is you have to social distance. That's how you can mitigate. So it's a brand new way to die. We talked about math, and I just ask everyone to try to walk in the shoes of other people. I'm concerned about empathy, especially as this goes on longer and longer than any of us had hoped, and that we have to deal with these severe and very extraordinary actions that are being taken. That thing about the flu, I hope that this is starting to die out, but here's a comparison from the Mayo Clinic on the difference between the flu and COVID-19. And we don't know exactly where the mortality rate is, and we're hoping it's going to continue to come down. But just take a look at the differences. So number of days between infection, you see symptoms, it's a long time. That's why this thing is, a silent enemy, because it's lurking, and there are so many people that are asymptomatic that you might not know you're being exposed, and that means the number of exposures is increasing because you didn't stay home, because you knew you were sick. You didn't know that you were sick. You never knew that you were sick. So the number of people you can infect increases, and increases to a place where it's really exponential. You see exponential growth in that curve, and that's why we're talking about curves all the time. So look at that hospitalization rate. So a lot of people get the flu every year and go to the hospital, and sadly, many pass away. A real number of people pass away from the flu and/or pneumonia, because pneumonia is this related thing that happens to you when you get sick and you go to the hospital with the flu. So much so, and so many people are infected, that there is an influenza network in the state and other places that evaluate whether or not people had the flu, monitor the flu, and watch outbreaks and try to deal with it. That's how big the flu is. Well, this is an order of magnitude different. It's 10 times different. That's a big deal. It hospitalizes that many more people. And now the mortality rate, this is the big one, and this is always a point of contention, or it has been to date. Oh, hey, the flu kills a lot of people, but the mortality rate of the flu is 0.1 to 0.2% with most annual breakouts. We're still trying to figure out where the mortality rate is on COVID-19. But even if it's 1 to 2%, again, that's an order of magnitude difference. That's 10 times the difference. It's a big deal. And just saw some recent research that suggested in some places that mortality rate might come all the way down to 0.6%, 0.6%. Wouldn't that be great? For everyone that thinks this is the flu, 0.6% is still 6 times more deadly than 0.1%. It's a big deal.
Well, Mayor.
Yes, sir.
At this time, the flu is our only comparative marker to go against and try to figure out, because we've not been experienced. In the past, the CDC's been in other parts of the world, and they track the starts of these viral outbreaks. This is a protein, what I was reading, but they track the start, and this one, they got a very late start on. They're playing catch up on literally everything. So that's why the vaccine wasn't developed, treatment isn't in place. I mean, they just don't have it. This one got ahead of them, and look at the damage it's doing. So
no, and you're bringing up a good point that we can learn from the flu. I absolutely believe in that. I'm talking more about if you see the guy on the internet that says COVID-19 is not a big deal, we should reopen society because it's the same thing as the flu. That's what I'm really talking about. I'm just asking people to take it seriously for the following reasons. And oh, by the way, it's much more severe than the flu. But to your point, we can learn by looking at history, and we're going to actually see that exact one in a second. And if we can go back to the presentation. So on testing, we've seen a lot of issues with testing, and there seems to be that there can be a disconnect, what we're hearing from our leaders, the president and the governor, and what they say and where they want to go, because they have these great ideas about testing, but we don't necessarily see that playing out at the local level. That's one of my big concerns. So personally, I can tell you, I'm a firsthand witness that it took me 14 days to get results. And that's a long time. Now, of course, I took it very seriously, and even though I wanted to be here with you and the public, first rule of slow the spread is if you're sick, stay home. I did. But other people might not have done it, maybe couldn't have done it, and how many people would have been exposed as a result? So the time, the lack of materials, the lack of personal protective equipment, the log jams. So there's a lot of articles right now online that you can find where LabCorp, Quest, 10-day backlogs, 14-day backlogs, so people aren't finding out. And the issue with testing is there's only 2 tools in the toolbox. There's testing and isolation and tracking, and then there's social distancing. That's it. So how can we stop the spread if we don't know who has it and isolate? And now testing. Council, this is, hopefully you can see it in your monitors, may be hard for people at home, but I wanted to share this. This is an analysis I did yesterday, and it's based on the state dashboard. And remember, with testing, the state dashboard currently is only capturing the testing that is done and administered by the Department of Health. It is not capturing all of the Cleveland clinics, the St. Lucie Medical Centers, the Lawnwoods of the world, all the private providers. But based on the information that was readily available for me and to all of us, I took the most 25 populous counties in the state, plus Martin County, and I did an analysis of tests per capita, and we ranked 22 out of 26. That is greatly concerning to me. I continue to advocate for additional testing, and I understand that in a world of limited resources where the whole world is being impacted by this, our whole country is being impacted, our whole state is being impacted. Excuse me. I worry, and I understand that resources have to go to where there's the greatest number of cases, there's the greatest need in total numbers. I worry about making sure that we're taken care of as a city of 200,000 and a county of only 325,000 and falling behind because it's really hard to get resources. The governor talked about flooding the zone, quote unquote, at Palm Beach County because they have a growing number of cases, they're connected, to Miami-Dade and Broward, where we have the greatest number of confirmed cases, and that they hadn't had enough testing yet. And if you can see that they are ranked 18 by this analysis for testing, but we're behind them. And we also know from the DEO, the Department of Economic Opportunity, report and analysis of commuting patterns. And with all those essential businesses out there, we know that thousands of people go in and out of St. Lucie County every day to Martin, Palm Beach County, Broward, and Miami-Dade. But to Martin and Palm Beach County, we know that tens of thousands of people go in and out every day. This is a great concern. And it's a reason why that I would like to write a letter to the governor and was seeking your input on any additional items that we might want to put in there. And also, as it relates to testing, I need confirmation. This information's 2 days old at this point, but it's my understanding that in our service area, there is an Abbott testing device that can return COVID-19 results within a 5 to 13 minute period, but they don't have the testing kits for it because those testing kits are going to Miami-Dade and other places. So the only other tool is social distancing, and we've been using it for more than 15 days, and the question is it working well enough? And the answer is no, it's not, and that's why the governor issued a safer at home order and unified the state in our response. That's why you saw the president pivot from an aspirational goal of Easter to the end of the month. And that's why we need to double down on the 30 days to slow the spread. And Dr. Carvelli, to your point on the impact that social distancing can have, hey, can this work? Well, we've seen Dr. Fauci, we've seen Dr. Birx get up at recent press conferences and daily briefings and say, yes, it can work, and this is how much it can work. We've heard Governor Cuomo do the same thing. We've seen many people across the country write on this, so we're seeing it. But to your point, Dr. Carvelli, we can study the past. So COVID is not the same thing as the flu that we're used to, but it is a pandemic, just like the Spanish flu was a pandemic. And National Geographic has a great, great story. I had the link here. And I couldn't provide all the curves because you wouldn't be able to see it in this presentation. But it studies the Spanish flu, you know, our deadliest pandemic in modern history. And it shows through the analysis of their curves of infection that cities that ordered social distancing measures later and for shorter periods tended to have spikes in deaths and higher overall death rates, and that cities that ordered social distancing measures sooner and for longer periods usually slowed infections and lowered overall death rates. In fact, in this analysis, you'll find that they can actually point to some of the cities and places that poked their head out a little bit too early because they thought that they were done, and then Dr. Carvelli, to your point, they got hit by that second or third wave.
Wave, yeah.
So we know from history that social distancing can work if we do it right.
Yeah.
And that's why I'm calling on all the people of Port St. Lucie, and I believe that the council is with me on that, but council, after I'm done, please let me know if there's something different. A call to stay home unless it is essential, you leave, and of course the governor's defined essential, so that we can reduce hospitalizations, save lives. And I'm also calling on us to thank those who are working hard in the fight against COVID-19, asking us to try to walk in other people's shoes, and when in doubt, apply the golden rule, and to help others wherever and whenever you can safely. And think of this as the old airline warning and safety training, where they always tell you to put your mask on first before you take care of the person next to you. So I'm calling on you to help as many people and calling on us to help as many people as we can, but do not put yourself in danger. Make sure you're doing it safely and pursuant to social distancing. And I think, and I know, that working hard, smart, and together will get through this. We will respond. We will then be able to recover, and then we will prosper and flourish. Those are my big picture comments, Council.
Mayor,
Ma'am.
I would be supportive of you doing a letter to the governor in regards to helping us increase testing. I would ask, though, that you would put something or formulate a comment in regards to capacity in essential businesses. I've received concerns that, for example, in grocery stores, you get a number of people in at one time, and it's difficult sometimes to maintain social distancing. So whether that's implementing a capacity limit, limiting, I've heard some stores doing one-way transactions through the aisles to make sure people aren't passing each other. But I would ask if the governor would be willing to do something like that to help us make sure we're maintaining that.
Thank you. I would be happy to put something in there about providing simple rules that all of us must follow. And just to give you a flavor, I want to congratulate him on the birth of his daughter. Yes. I want to thank him for his hard work and the hard work of our whole Florida team. And then I would like to talk about some specific issues, including testing in St. Lucie County, especially given our proximity to the greatest outbreak in the state, Southeast Florida, and point out that we're the interconnect. We are where Central Florida meets Southeast Florida. And if you look at the dashboard, you can see that every day those colors are changing to be more intense, where Orange County, Orlando metro area is going to that darker blue, where Southeast Florida already is that darker blue, and then who's in the middle? Vice Mayor?
I'm in favor of doing a letter. As part of the governor's order, when he talks about other essential services that may be added under the order with the approval of the state coordinating officer, I think that talking to the state coordinating officer about the capacity issue would be important, because then maybe he can set forth a recommendation to the governor for another amendment to say that, to help direct us in implementing or enforcing something like that.
That's a great idea.
Because, this is the go-to person, according to the governor, to talk about other things that need to be maybe amended. So let's try talking and seeing what he says, because that'll help too when, if our officers, or if we're going to have neighborhood services deal with some code issues or whatever it is during this on the enforcement piece, if the governor provides that for us, I think it'd just be a lot easier.
If you would just say, hey, everyone has to follow the 6-foot rule.
Right.
Unless because at the nuclear power plant you can't. Right. But it would be nice if we could just say, hey, everyone, even if you're an essential business, stay 6 feet apart. Dr. Carvelli?
Well, be careful over creating rules. If you do 6 foot, the cashiers would not be able to hand you your money back at Publix. So they installed shields. If you haven't been out there, the Publix are now installing plexiglass shields that separate the cashier from the person buying their goods. But I would consider, Mayor, once you create a rule, it could have unintended consequences with other things. So I'd be careful there in trying to ask them to impose a rule. I would say maybe limit capacity based on square footage. Like the usable square footage in a grocery store. The front of the store is X amount of square footage, maybe limit capacity. But we don't want to do that and then have people standing in lines for 5, 6, 7, 8 hours waiting to get in because they weren't first in line, they didn't get the goods they needed. You know what I'm saying? So we want to be careful not to overregulate folks so that it leads to these big-time unintended consequences. And I talked to Publix managers at multiple stores, and they all said that the warehouse is trying to evenly distribute goods to all the stores to avoid high-demand stores getting more goods than others and creating an inequity out there. So I've been in the Fort Pierce one, the one on US 1 near Prima Vista, the one in St. Lucie West, and I've talked to lots of the managers. But I would be in favor of maybe an amount of people per square foot, and that would reduce or increase your density. It's something along those lines.
Yeah, absolutely.
I don't think, yeah.
No, that's a good one, and I think that's where Councilwoman Carballo is coming from. And I think in our order that was superseded, it was 25% of occupancy on the one that we had. And I will tell you and share that in the lead up to the governor's order, he had been reaching out to different communities with a survey to see if the existing guidance was being followed. And I think a lot of replies to that was, no, sir, not really. And that's what kind of pushed him to take this additional action because he could see that even though a lot of people, probably the majority of people, are doing the right thing, you have some people out there who aren't. And we know that that's always the way it is. And quite frankly, that's why some enforcement is necessary. You can never force everyone to do everything, But that's why you have to have the trust but verify system of, hey, we trust people to do the right thing, but then we have laws and we investigate and take action where necessary when we get complaints or we see the wrong thing happening. All right, well, I really appreciate the council's discussion. Councilman Morgan, do you have anything to add?
I'm good.
Thank you, ma'am. You really have that down looking good in your office. So you have that better than any of the rest of us. Congratulations on that. That looks good in there. And your lighting is excellent. Anything else from staff? Because if not, I'm going to take a 5-minute break, and then we'll come back for the big discussion on 4B and the governor's safer at home order. Everyone good? Mm-hmm. We'll be back in 5 minutes. We'll see you at 4:40. And we're back from a little break. And you can't see him, but we do have a quorum because Dr. Carvelli and Councilwoman Morgan are virtually here online. And our next item, there he is. There's the good doctor. And there is Councilwoman Morgan. All right, so next item on the agenda is 4B. And originally it was a discussion of a safer at home type order here in the city. And I had put a call out that we should consider it. And since that happened, both the county administrator, Howard Tipton, approved a safer at home order that would have gone into effect on Saturday. But before that could go into effect, the governor acted, and later tonight at midnight, the governor's safer at home order will go into effect. And Mr. Manager and Mr. Stokes, there have been a lot of questions from the public about what does this mean, what's essential, what's not. Please help the people of our community understand the governor's order.
Yes, Mr. Mayor, we will do our best. But before you broke, the council was talking a little bit about, larger businesses, public assembly areas, and I wanted to just provide some information to you. I've asked the police chief and his team and our code enforcement staff and communications to work together to place on our website some examples of how larger businesses, places where people congregate in public assembly, how they can comply with the CDC guidelines. So it's simple things, like if you have a grocery store, and now sometimes people go up and down the aisle, the same aisle, concurrently. Well, the simple solution is, the store designates a pattern of how people go up and down in the aisles so you don't bump into each other, and you can stay 6 feet apart with your carts. So simple things like that. When you're queuing to check out, how do you queue to check out so that they smoothly get people out of the store, but let everybody maintain that social distancing, which we know is the only tool we have right now that really will slow down COVID-19. So we'll be providing that information on our website probably within the next 48 hours, and just with some graphics, some ideas, just suggestions that our businesses, our public assembly institutions can look at and say, hey, maybe they're better than that already. They've already thought about it, but just give some ideas. So, Mr. Mayor, I had planned a presentation on the St. Lucie County Safer at Home order, and it was written yesterday. It was ready. And in the midst of rehearsing that and making sure that we had everything right, the governor issued a safer at home order, which does supersede St. Lucie County's safer at home order. And I believe that St. Lucie County has now set their safer at home order aside. So I'd like to just take a minute to go through what the governor's safer at home order means at a big picture. So I would be the first to say that there are going to be some detailed questions that the public may have, that you may have, that we may not know the answer to. But if I can't answer the question, I'm going to look to Mr. Stokes and say, Jim knows that. But hopefully between the two of us, we'll provide information, and they'll just at least get us, a general understanding of the governor's order. So most importantly, this order applies to all of St. Lucie County and every county in the state of Florida. It applies to every city in the state of Florida. There's some things that are important, and these are questions we've been asked. These are the mayor, you were asking and suggesting a Q&A. Well, these are the first things that will be on that Q&A. Do we have a curfew in place? No, we do not. Does the city require, and we will reach out as well to the county and the sheriff's department, do we require a pass for a business person engaged in an essential service to drive on our roads? The answer is no. We don't have any intention of doing that unless we see widespread disregard for the order. So what does stay at home means? That means stay in your house 24 hours a day, 7 days a week, except the order is very clear. You can leave your home to either work in an essential service or to access essential goods and services. And so that's really, this order is built around that concept. So these are directly from the order. All persons in Florida shall limit their movements and personal interactions outside of their home only as necessary to obtain or provide. That's the key, obtain or provide. So if you're working in a grocery store, you're working in an essential business, you're a provider, or you're obtaining those services. So it's directing citizens to stay at home as much as possible during our continued COVID-19 crisis. Again, though, you can access those essential services. You can go to your doctor, although we would recommend call first. Make sure that they have a chance to triage you as to what your issues are. It allows non-essential services if you can comply with the CDC guidelines. If you can't, they're not allowed. And it allows local jurisdictions, and this is important for the city of Port St. Lucie, and this is in the order, it's the most specific and direct thing relative to the city. We are to ensure that groups of people greater than 10 are not permitted and don't congregate. And so this is where our police department, our Parks and Recreation that has the authority to trespass on our parks, this is where we'll be working through those issues. And this is where Port St. Lucie has a direct responsibility.
Is it greater than 10 or is it 10 or more?
It's 10 or more. 10 or more, yes.
So 9 or less, 10 or more.
Yes, that's correct. So to look at it in another direction, it's the yin and yang.
Where does it say allow non-essential activities so long as social distancing and other CDC public health mitigation strategy requirements are followed?
I believe that's in the Miami-Dade essential.
Okay, Mr. Stokes, I want you to clarify that by the end. It was definitely in the county's order, but I don't remember that personally, so I just want to be able to cite it. I got all my notes and highlights here, and that's not on the list. Please carry on, sir.
Yes. So most importantly, what can citizens do? So you can go to the grocery store, a convenience or warehouse store. You can commute to and from work. We would anticipate those essential and non-essential entities to be following the CDC guidelines. Go to the pharmacy, medical establishments. You can go to a medical appointment. So there's a lot of things you can do under this order. You can go to a restaurant to access their drive-through or their takeout services. A previous order by the governor restricted in-restaurant seating for eating establishments. You can care for and support a friend or family member in need. You can go for a walk. You can go for a run, a bike ride. Just have to maintain those social distancing requirements. And you can walk your pets or take them to a veterinarian and take your child if they're needed to go to any kind of a court-ordered appointment.
Mayor?
Yes, ma'am.
So I think, Mr. Manager, I've had 2 questions with regard to custody sharing order. So if we're going to do a Q&A, I think that should be something that should be added in there. And, you know, when we're going back and talking about the guidance for the supermarket spacing, I think if we can do that, or in some way, that's been the biggest, one of the biggest issues is everyone complaining, well, everyone's in the store and no one's practicing it. And so I don't know how, because the governor's order supersedes everything, so I don't know how we're going to address that, but if there is a way, if first going through the state health officer, maybe there's a way, but locally here, maybe if we could provide the guidance, I think that's important. I don't know that we can require them to do it. Some stores are doing it. I've been in Publix. They have signs out all over asking people to do it, which I think is great because it's a reminder when you walk in the store, oh, I have to do this, and they're all over. I know that Wawa was marking, you know, things off with tape. So if we can encourage that some way, that would be great.
Vice Mayor, let me give you an amen on that. And the president is asking the whole country to slow the spread for the next 30 days. We know what those guidelines are. The Miami-Dade order urges us to take all guidelines into account. So even though they can't be mandated, nothing stops our police department, neighborhood services, and other tasked team members. Nothing stops them from going in and saying, hey, can we work together to implement as many guidelines as possible? Can you do the one-way aisles? Can you help people with rain checks on toilet paper so they don't come in 10 times in one day trying to catch your shipment? Can we ask people to only bring one person in the store? Can we make sure that on senior day there aren't 500 people here? You know, there's nothing that's stopping us, to your point. Let's do it, and let's get better at it every day.
Yes, Mr. Mayor, the question that is, they don't have a whole category in the governor's order about what is a non-essential services. It's pretty simple. If it's not listed as essential, it's not essential. There are a few, and I'll give you an example, and this is directly from the Miami-Dade list of essentials. You may have a non-essential business that would not follow into the essential category, but you do it all online. And so then that non-essential can still operate, but it has to be online. Nobody comes in. You're providing it as you're shipping it out. So that's one of the provisions in the Miami-Dade. But most importantly, you have to look at each one of those essential businesses that are identified either in the federal list of essential businesses or in the Miami-Dade. So there are resources that can help you, point you in the right direction. We certainly will try to make sure that essential businesses are identified on our website where it is clear. There will be questions, and I think we can all, and you've probably already gotten calls from people about, an unusual business. Is it essential or not? We will try to point you in the right direction where you can try to answer that question easily, and we do have a lot of resources.
And right now we're getting alerts on Facebook Live that the governor's on, so something could be changing this very moment.
Yep.
That's right, and I've heard a couple of questions that were not clear in the governor's order yesterday to a lot of people, and I hear these clarifying those today. So some essential businesses, and this is just, we'll have all of this information on our website, but these are listed in either in the federal document or in the Miami-Dade or both. Grocery stores, drive-through delivery, airlines, taxis, others, gas stations, laundromats, veterinary offices, business engaged in food cultivation, livestock, hardware, gardening stores, radio, newspaper, media. We had a note recently from TC Palm wanting to remind us that they are an essential business And indeed, they are in the Miami-Dade list as media and in the federal law. And businesses that provide food and shelter.
If we could just pause right there, Mr. Manager, a lot of grocery stores, and your staff has been doing a great job with the supply list that's at cityofpsl.com/COVID-19 under supplies. Every day, they try to track and coordinate with the various retailers, grocers, and pharmacies on what they have in stock, if they're running any special programs, and they provide a phone number so that people could call directly. So that's outstanding. And one of the things I've noticed is that almost all the grocers are going to Instacart, where you can have things delivered. And a lot of people are getting deliveries. But I've also noticed on Nextdoor and heard directly from people that they have had their Instacart deliverer steal their stuff. Have we gotten any reports of that? Has that made it to the police department? And if so, I want to bring down the mighty hand of the police department on anyone who would steal from anyone during this pandemic.
That's a great point, Mayor. Chief, I don't know if we have any reports.
I haven't heard any, but I've been in a lot of meetings.
Okay, right.
Okay.
I know
So I just want our posture to be
Yes.
that we will not tolerate that. And, you know, this is the safest large city in Florida. It's one of the safest places in the country. And during a pandemic, there can't be deliverers stealing anyone's goods, or any other porch pirates for that matter.
So this, the list is extensive of essential services. Some of the others certainly include our first responders, city, Port St. Lucie, the police, fire rescue for St. Lucie County, or the other local governments, essential federal, state government employees. The Port St. Lucie is considered, and specifically local government is mentioned in the order. The school district employees, if you're seeing, school district folks going and coming, they're listed. Medical and health professionals. So the CDC is really the backbone of these recommendations of, what are things that we should do and how can we help slow the spread. The mayor, in your presentation, you mentioned, I think we've seen it on TV, every night with the president, Dr. Fauci, and others. We don't have a vaccine, we don't have a treatment, but we can really slow the spread and reduce the impact on our community by, if you're sick, stay at home. Wash your hands a lot. Practice those social distance issues. Don't meet in groups larger than 9, and then stay 6 feet apart. I can tell you from our experience as a city government, your staff has been doing this, been working very hard to make sure if we don't have groups that are meeting in a smaller room. Certainly, the bigger the room, you'll be able to spread out a little bit more and get your 6 feet separation. But even there, we're limiting the number of people in our room. So,
Mr. Mayor.
Yes, ma'am.
And this might be a question for Mr. Stokes. Now that the governor has issued his order in regards to any other measures outside of a curfew. So for example, I got an email from a resident that wanted us to mandate everyone wear face masks, or additional measures such as that. The city is not in the position by state law to make any further mandates outside of the governor's order, correct?
That is correct. I mean, the preemption language that the governor used in his latest order says that this order shall supersede any conflicting official action or order issued by local officials in response to COVID-19. So it's, no, we can't take any action or anything that conflicts with their order, with the governor's order.
Thank you for that clarification. And I'm sure I'm not the only one, but I've gotten several emails even after the order we want you to have this meeting and do this and do these additional measures. And I just want to make sure that the public is aware that other than a curfew, because I think that's the last thing that we're allowed to do, there's nothing else that we're allowed to do. Thank you.
yes, Mr. Mayor, one of the questions we've received is, well, what's the penalty if you gather in a group of more than 9? and you know, how is this order enforced? So I'd ask our city attorney for help on that. It's a second-degree misdemeanor, similar to the order that was drafted by the county. We as a city, like say early on, I mentioned that's one of the specific things that local government is asked to do, is enforce them and ensure that people don't gather in groups larger than 9. So, and then, yes.
And I'm just so to get really specific so people know that I just want to, we're asking for compliance here. And if somebody doesn't do it and the police have to deal with them, then they'll make that judgment call based on the actions of what is going on at that time. Because I've had questions, are they automatically gonna, charge them? I've tried to explain about how officers have discretion, that we don't want to put people bring people to the jail because they don't want any issues with possibly infection in the jail. So compliance is the key here, and everyone should know that. That's what we want.
Mr. Mayor, Councilmember Martin, our approach is going to be voluntary compliance. We certainly will, if we find somebody or a group of folks that's playing soccer, and there's 10 or more, we're going to ask them to voluntarily disperse. And we're going to give them a little time to do that, but not much. We're going to ask them again if, at some point, we may have to issue a notice to appear. But our goal, this is an order of the governor. It's an executive order. It is meant to be complied with, but we want voluntary compliance every possible way.
Thank you, Vice Mayor, for bringing up that important point. And I just want to communicate my hope and expectation here. This is, let me divorce it from the official guidelines of the police department. This is just my hope. And I really appreciated that Howard Tipton used the word knuckleheads during the press conference when they were discussing their safer at home order. Because Vice Mayor, to your point, we always want to be friendly in a safe city where we all work together, we're all pulling in the same direction. But if you're a knucklehead and you are putting other people at risk because of your selfish behavior, we'll try to educate you. That's what I would hope. But if that fails, if you fail the customer test, if this is the 3rd time we're going out to McChesney Park to tell you that, no, you can't play soccer with 100 people, then I hope that they're subjected to increasing enforcement, escalating enforcement at that point. Because, folks, we just don't have the time and the resources to be there policing your bad behavior when our fellow neighbors and citizens' lives are at risk, that increased hospitalizations are at risk, that our community is at risk. We can't mess around with bad faith actors. We don't have time for that. So if you're acting in good faith and you just didn't know, you're not going to get stopped driving from here to there. You're not going to, the arm of the law is not going to reach out and try to hurt you. We're going to try to help you. But if you're acting in bad faith, you're showing a blatant disregard for the very lives of your fellow neighbors, well, then I hope that you are given an opportunity for new opportunities, I hope, and that you actually do see some enforcement.
Mayor?
Ma'am.
Yeah, and every time that happens, you're also putting our law enforcement officers at risk. And we need to make sure that they are healthy, that they're not going home to their families and possibly infecting their families. A lot of people think that, okay, they're just annoying people or going out for whatever reason. That's not it. They're not robots. They're there to do the job, but they're human beings. They have families too, and they have to go home and protect their families while they're dealing with the public and dealing with these situations. So I really hope and pray that people really take that to heart and into consideration when they're, during this time, when they're continuing doing whatever it is that they're doing.
Mayor.
Thank you, Vice Mayor. Yes, ma'am.
Just like you said earlier, that this is just another way to die. This is also just another thing that has been added on to the long list of items that our police department, our fire departments, our administration has to has to worry about, take care of for the safety and health and welfare, it doesn't stop their work. They're still dealing with traffic issues. Yep. They're still dealing with domestic issues. Yep. They're still dealing with all these other issues. Plus now they have to go to your house because you decided to have a party of 40 people. And, and so in that situation, I mean, it's common sense. We're all dealing with this COVID. There's no way, not a single human being in this earth right now doesn't know that this is a danger and you have to socially distance. So just act responsibly. That's it.
And we certainly see this even in the best of times. The people who do the right thing do not appreciate it when someone, one of their neighbors or someone else visiting, does the wrong thing. No one likes that. Thank you for those points. And Vice Mayor, thank you for pointing out the threat to our first responders, our police officers, and then also this discussion of fire. Mr. Manager or Mr. Police Chief, haven't there already been breakouts, outbreaks in first responding units down south? Hasn't there already been a wave of confirmed cases, NYPD? I mean, this is a real issue because then you lose manpower just as your curve is going up, and then you have reduced manpower at the exact worst time.
Absolutely, and that's something we've been planning against from the very beginning with going to the virtual briefings and not ever having multiple officers in a room together, because that was my biggest fear was, one person gets sick and wipe the whole shift out. So, yeah. But we're been very cautious about that, and we're very cautious about too many people on a call or and keeping the officers separated and social distancing. But I wanted to comment on what was said earlier, just briefly. You hit it good with the good faith actors and the bad faith actors. We're not out there to put anybody in jail on this. We're out there to make the community safer, and we've got our marching orders, and we're going to do it in an educational way. However, if you can't be persuaded, trust me, between the attorneys and all of the sheriffs and chiefs of police, we have an action plan. So don't push it. That's my message.
Awesome.
Thank you, Chief. We're very proud of you and our award-winning police department. Thank you for everything.
Mr. Mayor, that concludes my presentation and overview. I don't know if Mr. Stokes has any things that I missed.
Oh, we definitely have to hear from Mr. Stokes on this. Thank you, Mr. Manager. How about the actual clause on that non-essential, allows non-essential activities so long as social distancing?
Yeah, that was a mistake, and I apologize to Mr. Blackburn and his staff because we did review this PowerPoint. We did start the first review when it was a PowerPoint about the county's order.
Yeah, that's a relic,
It then changed, and this was just something that slipped through. And after you brought it up, I just confirmed, looking at the governor's executive order in addition to the Miami-Dade, which keep in mind the governor's executive order only references the Miami-Dade County ordinance for its list of essential businesses, nothing else operational. But even in that case, and then he references a prior order that he put in place for the southeast counties, Broward, Miami-Dade, Palm Beach, and Monroe. And in that one, it very specifically says that you cannot be out for non-essential. So non-essential, you cannot be out for non-essential. You have to, if you're going to be outside of your home on the street, you have to be engaged in or going to and from something that's listed as an essential service or an essential business, which is a long list, but which includes like recreational and stuff like that. But you do have to tie it to something.
And it did become more specific. So just because this is going to live on forever, and I know exactly how it happened, so I definitely understand. But since this is going to live on forever, can we correct the PowerPoint that gets rebroadcast and just fix that in the replay?
Yes, yeah.
So that we don't, so we can get that genie partially back in the bottle?
Yeah, we don't want to give out misinformation.
Right.
Mr. Blackburn and I even talked about it today, how on PSL 20 we tend to rerun our council meetings and stuff, and the information that we're dealing with is changing so rapidly that communications is looking at how to maybe not rerun stuff quite as long because it ends up with stale information. And the county's channel is doing the same thing. They were rerunning press conferences with stale information, and it's a problem. So.
Mayor?
Yes,
So
ma'am.
as part of the Q&A that we put out, can we specifically put that, no, not, if you're not essential business, you cannot go, you must be in, you cannot have any non-essential, it's closed, that's it. Because the newest thing that gets put out with this Q&A is what people are gonna see when we put it online and then we blast it on Facebook as well. So that's really key to make sure that that's the newest information that has to go in there.
Well, and to your point, Vice Mayor, given how fast everything changes, it's really important to sequence our statements and date stamp them.
Yes.
So this is the 14th statement we're making on COVID. It's being made at 5:12 p.m. on April the 2nd. We really have to do that. And then in the next one, you know, this statement strikes through the following things and adds these things.
Yeah.
And I heard Dr. Carvelli?
Yeah. Mayor, two things. Date stamping, that's what the state's doing. I'm getting the updates every day through the Principals Association, and it's very clear that it's that day's report by time. That was an excellent suggestion. The other thing is, you've mentioned Facebook, social media. If we could do a question and answer and scroll it as a rerun on our TV until it becomes outdated. Don't run it like the attorney just mentioned, Mr. Stokes mentioned, putting outdated info is not good either. But if we could do a Q&A and put the update time and date stamp, whatever you want to do, but I would roll it on our TV station because a lot of the folks, the elderly folks, don't use Facebook or they're not online. They do watch TV. I called someone in between our 5-minute break and they said, I'm watching you on TV. They don't even have a computer at the house.
You're right.
So
that's a great idea.
Run it as like a scrolling PowerPoint, frequently asked questions, let it roll on the TV screen. I guarantee people will watch it.
I love it. Very good idea. And you're right. And I issue the statements of my office through Facebook and newsletter just because the people don't do Facebook. There's a whole population that doesn't do Facebook, Dr. Carvelli. You're 100% correct.
But a lot of them watch TV, Mayor. I guarantee that.
You got it, sir. You're right.
No problem.
You have a big presentation? I thought you were going to go all in on this.
No,
I thought you were going to do your Perry Mason thing.
I've got no presentation per se. I can answer any questions you have. This has been as we all know, a rapidly progressing thing dealing with the county order, followed immediately by the governor's order, and then an amendment that he made to the order. And as far as figuring it out, I had one of my attorneys spend 4 hours yesterday, trying to compare and contrast the county order and the state order, and then the governor clarified this morning that he absolutely meant it to be a complete preemption of local orders. But we've done our best to come up with, the important thing, and it's something that I put out through Mr. Blackburn to staff today, and I know that all of our employees here are very customer service oriented, and that's a good thing. I think that's been impressed upon them, and I think they've responded well to that over the years. The problem is what's happening right now is individuals, as has been mentioned here today, are calling on specific circumstances, and that is really dangerous, and that's what I tried to warn against. It's as counterintuitive as it might be for our employees. What we have to do is help people, lead them to their own answers. They're getting questions like, my son is an air conditioning mechanic, and he has, a lung condition, and his boss is telling him that he can only do, and all this, and we can't get into that because as soon as we start applying individual facts to the law, then we're practicing law and we're giving the city a whole lot of liability. If somebody calls and says, do I have to shut down my business? We say, yes, you do. And maybe they didn't need to, and then they're going to come back and say, well, the city told me I had to shut down and they were wrong. So we're trying very hard. And even I know the council office has fielded like 25 calls before 9 a.m. today from people wanting specific questions answered. And what we're trying very hard to do is direct them, and maybe direct them to, section, of it. Well, if you look at section 4B, it covers that area, but they have to draw their own conclusions as to what they can and can't do. And we have given phone numbers both to the state coordinating officer, as well as the county EDC, which has offered themselves up as assisting businesses in knowing what they can and can't do. So we're offering those numbers and websites as resources.
Okay, so we understand that you can't give legal advice to private citizens, and I think that's fair. But am I not allowed to have a conversation to talk with someone about, did they see that provision, and what I would do if I were you? You're telling me I can't have an opinion?
I mean, you can, and yes, as far as pointing them and pointing out what the provisions say, I think that's safe. The only potential exposure, and this would be my concern, is the second half of what I said, is that if somebody comes back later, keeping in mind that these claims and these lawsuits are going to be 2 years down the road when everyone hopefully has this as a distant memory as to what we're going through right now, and they're going to be, I had a small mom and pop dry cleaner. I called City Hall, and City Hall told me I had to shut down. And now I'm...
No, we wouldn't do that. They're exempted in here. They're essential.
Well, sorry about that. But that's my concern is, and of course the question will be, who'd you talk to? I don't know. I just called the main number and someone told me I had to shut down.
I'm sure it'll be...
So that's what we're trying to get the employee... I'm sorry.
I'm sure it'll be the mayor's fault when that happens, whoever it is. But
so that's why I'm trying to stay away from specifics. But I know especially the five of you as elected officials respond to your constituents in a different way than staff does. And I guess the only caution would be give them the guidance as you feel appropriate. But just be careful on being too specific of telling them what they can and can't do. Maybe pointing them in a direction.
Well, but I guess the point, and Vice Mayor, I'll go to you just right next, is that if we're not telling them what they can and can't do, then I guess we're not sending in PD to shut them down. So there's no heavy-handed enforcement response then anyways. Vice Mayor?
What I've done is, especially on Facebook, I share the order, and then if I'm asked a question, I will take the provision out of the order that refers to it, and I will post that. Because here's the section that we were talking about this before. If janitorial service, I had that question. Here it is. Read it for yourself. Here's the section specifically. They can read it for themselves. That's essential. And that, to me, that answers the question. But as far as my opinion, I am completely refraining from giving my opinion about what's essential and what's not. I direct them to the order, and then if it's in there as a provision, there. But I won't give my opinion on whether someone should open or close, be opened or closed or not, because I don't think I should be doing that.
And I think that's a safe response. Very much.
Well, let's play a game of specificity, won't we?
It gets hard.
Do you have your order with you, sir?
Yes, I do.
All right. Would you please go to the guidance on the essential critical infrastructure workforce portion of the order? Will you please look at the section entitled Other Community or Government-Based Operations and Essential Functions, towards the back, second to last page, if you're dealing with a double-sided.
Got it.
At the top of the next page, do you read the bullet, residential and commercial real estate services, including settlement services?
Yes.
Do you think a reasonable person would say that that includes realtors?
I would think that argument could be made. Residential and commercial real estate services. I think that would be realtors. Yes.
So if someone called us and complained that they saw a realtor putting up a sign, would you refer that to the police department for enforcement, or would you look at this and say it's an essential, think that it's an essential service?
I would probably not refer that to the police department. I think that would be a waste of resources. So no,
Thank you for playing that out for real. So even though you don't want to provide an opinion, which I understand because you can't provide legal advice, there's a lot of realtors watching right now. There's some that have signed up to speak, and I want to get them the answers to their question. Now, Jim, you did an amazing job answering my questions. So you and your team, thank you so much for answering my 10 questions about the governor's order. I think you did a bang-up job. So, council, I don't know how you felt when you heard the governor had expressed his intent to issue an executive order, and then how you felt when you read it. I was very happy and enthused to hear that he had taken this additional step and was going to utilize this tool in our fight against COVID-19 when I heard about it. And then when I read it, I just had some creeping concerns, and I want to share with you my largest concern. And I want to urge, I'm going to call on the citizens of Port St. Lucie and our faith leaders. So one of the things that just had me, you know, when you're fighting a fight, sometimes you're up, sometimes you're down. There's a lot of emotion in it. And why I was down yesterday is because the governor's order includes Section 3 entitled Essential Activities. And it states, for purposes of this order and the conduct it limits, essential activities means and encompasses the following: attending religious services conducted in churches, synagogues, and houses of worship. And why this one worries me is not because people want to engage in worship. Of course they do, and I want them to. We need God now more than ever. So I do want everyone to worship. But I want, and I'm urging everyone to be safe. And to be safe, you have to be socially distanced. You have to follow the CDC guidelines. And this virus, our silent enemy, it doesn't care why you're in a room with 250 people. It doesn't care if you are in a room like this for the higher purpose of worshiping God, or if you're in a room like this for a council meeting or for the social purpose of an R-rated movie. The virus doesn't care, and we already know from experience that New Rochelle, that outbreak was around a synagogue. We know that an outbreak was in Washington around a choral group that met at a Presbyterian church. We know the virus doesn't care why we are gathered together. It only takes advantage of the opportunity to replicate and spread. So even though the governor said we could worship, and on Easter we can get together and go to our nearest super church, and there's no limit on the numbers, and we could pack 2,000 people in a room, please, Port St. Lucie, and please, the shepherds of their flocks, please continue to innovate like you have to do the telesermons, the Christ Fellowship. Shout out to Christ Fellowship. They have been such an amazing partner. Yep. in all times in Port St. Lucie, good and bad, and especially in bad, they're there, and they're leading by example. Vice Mayor, I know you're part of that congregation of doing it by broadcast. Other churches are doing that. And another innovative approach that our churches are implementing is the good old-fashioned drive-in movie. So we're going to get together so that we can praise God as a group, but we're going to do it from the safety of our car, just like we were going to get our COVID-19 test. So here's a way for us to be a self-contained family unit, but still come together in a group to lend our voices to prayer with a pastor up front. You're a pastor, there you are. We're here in our cars. We're turning on the radio station, and we're having service together. That's a way to do it safely. You know, just because we can do something, it doesn't mean we should do something. And I hope that we will use our better judgment when it comes to packing a synagogue, a church, a temple. Let's stay socially distanced and safe, because I don't want to see Easter or any other Sunday or holy day be the day that 400, 500 people got sick in Port St. Lucie. So that was my biggest thing, Mayor, Vice Mayor, and council members. So I don't know how you felt about it or the other issues you want to go through, but that was the big one for me.
That was the big one, absolutely.
When we talk about, so I know you don't want to get into specifics, but based on my reading of this, it's very clear that the Ivy League Preparatory Academy should not be operating a K-8 school in Port St. Lucie. This order is very clear that schools should only be getting together for the purposes of distance learning. In fact, if you look at the federal guidance under other community or government-based operations and essential functions, it says educators supporting public and private K through 12 schools, colleges and universities for purpose of facilitating distance learning or performing other essential functions. So that's not classrooms of kids at the school. And then I believe you also find that Miami-Dade deals with this issue also.
Yes.
And when it comes, so Ivy League Preparatory Academy has a K through 8 element, and they also have a child care element. And according to the Miami-Dade order, child care facilities providing services that enable employees exempted in this order to work as permitted. To the extent possible, child care facilities should operate under the following mandatory conditions. Child care must be carried out in stable groups of 10 or fewer. Children and child care providers shall not change from one group to another. If more than one group of children is cared for at one facility, each group shall be in a separate room. Groups shall not mix or interact with each other. So if this business has a K through 8, that should be shut down. If it has a child care center, it should only be for essential businesses, the parents of their children, the children of parents of who work at essential businesses. Do you disagree? Are you providing alternate guidance?
I do not disagree, and I think the guidance would be that Mr. Blackburn, myself, and the chief probably need to talk about this and see if we can't reach out to them to see what their long-range plans are and see if we're going to see some voluntary compliance.
Well, I really appreciate it. And counsel, because you read the letter I sent you, one of the reasons why I was making a call to a safer at home was because of not all the good people that were following it, the other actors who weren't. And this was right at the top of that list.
Mayor, so I agree. If there's a child care element, they should be following it. But if they are operating as an actual school, they should not be allowed to operate as a school.
I heard they were open today.
Yeah, so that's really poor, very, very poor judgment and disappointing if that's the case.
We called yesterday, so I've been working this case because so many people were concerned about it. And I had Brandon call yesterday directly to ask if they're still operating, and they said, yes, we are operating right as of now, and that was yesterday.
We have a game changer as of midnight tonight because there's the new order takes effect. And they're not listed as essential.
They need to be made, if they're not already made aware, they definitely need to be made aware and to stop.
And again, it's not to hurt them.
No.
If they're hearing this for the first time, it's not to hurt you. We're glad that you're in the community and you're taking care of kids, but right now, we're all making sacrifices. The entire school system of the state of Florida has shut down and went to distance learning to protect people. The state university system has shut down and gone to distance learning to protect people. You follow the same principles. The only thing that's different about you is the label. We need you to follow their lead and do the right thing. So thank you so much for that. I look forward to dealing with it. Now, this isn't our issue so much, but it impacts residents who work at this industry. Car dealerships, surprising to me, are an essential business. But Jim, how do you do a test drive and follow the 6-foot rule?
I mean, it does call that they should comply with those same standards. And I haven't reached out to any car dealerships. I will tell you, I bought a new truck a few months ago, and when it was time for me to take a test drive, they threw me the keys and said, take it out. So, and I do know that that's done a lot nowadays.
Well, you're a pastor, LEO, and an attorney. They probably trusted you.
If they'd known I was an attorney, they never would have done it. So, and I suppose if it was a larger car, if they were in the back seat or whatever, but I don't know how car dealerships are doing the test drives. I mean, we could maybe make some inquiries and see, but.
I'll farm that one out. I'm going to call on Chairman Townsend.
Okay.
Mayor.
That's true.
Yes, sir. Dr. Carvelli?
Yeah, that's a county issue. We don't have any new car dealers. We have one maybe used car dealer on US 1, if I remember, and that's about it in the city limits.
Well, that's why I'm going to reach out to Chairman Townsend directly. Yeah. But just to the point, why it's a big deal for me is because the virus doesn't respect the boundaries, and that's why I worked hard with Chairman Townsend for the county to order the arcades closed. And then it doesn't respect our boundaries, and then plus our people work there. Residents of Port St. Lucie are working at the car dealerships. They were going to the arcades before, and the virus doesn't care. So care about our residents, our county, and our state, and just, you know, what could we do to help? So you're right, we don't have the authority, so I'm not the best person to make the call. Chairman Townsend's probably the best person to make the call.
Mayor, you just, and this conversation just reminded me of another question that came up with regard to, you know, our mass transit, our bus system, which we don't control. But there was a question about what they're doing on the buses, if they're doing the social distancing, and how they're cleaning the buses since they have people coming on and off, and what they're doing there. So I think that's important to get out to people who are using the transit system so they know what the protocols are.
Thank you.
To the other point, Mr. Mayor, as we know, the businesses that are essential, Publix and Walgreens and whatever else, I mean, even when you walk up to the register, at that point, you're within 6 feet of the employee. And the only thing I could imagine, and I still don't think it's safe practices, but if they consider that the salesman dealing with a single customer is akin to a cashier dealing with a single customer. I don't know if that's the way they're looking at it, but I do agree, once you get into an enclosed car and take a 15-minute ride, then you know, you're definitely upping your odds there.
No, so I was in my house, right? So I didn't get to have these experiences personally the whole time that you were. But yesterday when I finally broke out and I went to the sub shop to give some local business to J&C on Bayshore, made some very delicious subs and a great antipasta salad. When I went in, it's a tiny shop. So I bring in my Clorox wipe, I open the door, but then yeah, to pay, you have to come in range. And then in a little shop, if one other person comes in the door behind you, you're like, man, where could I go to maintain 6 feet? It's really tough to do, and I think it underscores the point that you're safer at home. Like if you can, stay at home, get delivery, get your groceries delivered. You know, that's really the way to do it, I think, to your point. Pay electronically so you don't have to give anyone your card or come within sneezing range.
Well, those point of sale, you know, little push button things. I sat there and watched four customers in a row use the same keypad, one right after another.
Mayor, I was at the Walmart neighborhood market in Darwin yesterday, and when I walked in, they were wiping down all the carts before you got the cart. Not even just with the wipes, they had other things to wipe them down with. And then what I did see, which I was very surprised and happy about, was in all the self-checkout lanes, after people checked out, they would go down and wipe the area, and they were wiping down the pin pad. Because, yeah, when you look at that and you're like, oh, I got to touch that, that could be kind of scary for some people. But I was surprised, but they were taking that step. I don't know if all the Walmarts are doing that or not, but I thought that was pretty good to see that they were taking some action and trying to help with that. So that guidance, I think, is great, too. I know it takes a lot of extra work, but it's all about slowing the spread, like you said.
All right, anything else for Mr. Stokes? Yes, sir. Dr. Carvelli?
I was in Walgreens. Today I was in Walgreens and CVS in St. Lucie West. CVS has a plastic shield. When people pay, the items are slipped under the bid. It covers the whole area by the pharmacy, and they all have 6-foot markings as you walk up to all the registers. So the businesses are taking it seriously out here in St. Lucie West. I've been in a lot of them.
No, and to everyone's point, we're fighting this fight every day. We're learning every day. We're going to implement what we learn. We're going to get better, and we're going to win the war. Anything else for Mr. Stokes? Nope. All right, then I will go to public comments. And Deborah Butel, if she's out there. Good afternoon, good evening.
Good evening. How's everybody?
Hanging in there, fighting the good fight.
So I understand that the health and wellness is important to people, of course, first, and then, of course, businesses second. So I know these are interesting, unprecedented times. We're certainly evolving daily according to our circumstances. From a full-service restaurant perspective of a small family business, which is an essential business, our lives have been turned upside down, where we're continuing to manage through mazes and adapt with all the new items happening. We're taking every measurable step we can to keep everything clean, sanitary, and provide a service to the community. So with that being said, just to notate, you did state that, I'll skip ahead because there's been a lot of repetitive information, is that some of the residents are concerned with the stay safe at home, that they shouldn't ever leave their home. Unfortunately, there's some residents that are scared to come out and pick up their food. I think that we have a safer environment than most, including the stores. But that's just our place. I can't speak for any other restaurant. I've seen many of the people that are choosing to stay open take extreme measures to make sure everything is safe. So I hope that the community responds appropriately. And of course, delivery is always an option. So we are looking for some support from the city as your business partner. Some of the ideas that we've provided have been responded to by Mr. Wooten, and that was signage. So he's letting us put up little signs. Unfortunately, for essential businesses, we may need a little more than that. So that we're asking if it's possible to just temporary signage only during this crisis be allowed for essential businesses. Just skipping past. The next idea I had was on your website. Mr. Blackburn, you said that there was a section on the website that notated what businesses are open, hours of operation. I haven't found that easily. I'm not sure where it is. Maybe that's something that we can work on. I know that Mr. Wooten sent out a survey. The city already has everyone's email addresses according to when we filled out our business request to do business in this town. So rather than waiting a week or two for a survey, my idea would be any businesses that want to participate, you send an email out. If they do, great, it's added on live. If that's possible with the staff that you have right now. So the next item was just leading on to the business taxes. There was an update that recently came out, and it notated that why it exists when a business first opens, so that you can get all the proper information, make sure that they're properly licensed and following all the rules. And perhaps this year you may think of reducing it or negating it for the businesses that have been established and been in business, not new businesses. Just a thought how city could be a business partner with us.
Thank you, ma'am. If you'll maybe just wipe off the corner of that and put it on the podium here, we'll take all of your comments and we'll try to respond to them.
Okay.
And then, is Brian Sharkey here or is he online? His question was about real estate, and already addressed that when I had Mr. Stokes under cross-examination. And also online, Brian Mulrooney typed in to share that with both the county and state enacting safer at home orders, I'm generally opposed to creating overlapping city-specific orders, and goes on to talk about that issue. But that was all rendered moot. Really, it was rendered moot when the county did it, and then it was super rendered moot when the governor did it. So at this point, all of Florida is under one order, one unifying, we are safer at home order. Madam Clerk, any additional online comments come in for public to be heard?
No, sir.
Thank you, ma'am. Council, would you like to respond to any of the comments that were provided?
Mayor.
Yes, ma'am.
I would like to say that I received notification from Mr. Tamboni today, and I don't know if Mr. Wooten is working with him or not, but he is putting together a website, it appears, to help connect all the residents with businesses that are open, restaurants specifically in the county that are open and hours of operations. And so this might be one of those opportunities that we spoke about where we assign a person that's doing it. He specifically is highlighting just restaurants, it looks like, and his company emailed me directly today about that. And I just want to say, because I'm a small business person, and I ran and operated a small business for many years, and you know, Ms. Butel, I have a tremendous amount of respect for you. I've known you a number of years, and you started off by saying that, you know, we're looking at people first and business second. And I think that business is people and people is business. So people are business. Let me make sure I use proper grammar. People are business, and we can't do business without people. And so there isn't really a ranking necessarily in regards to when we make decisions or when I'm considering decisions up here. Health, safety, and welfare are chief concerns, because if the people aren't alive or well, there can be no business. And so I just want to make sure that, you know, I just share that with you. None of these decisions that I think the governor's making, the president's making, our city is making currently are easy decisions, because we all understand the financial impact in our personal lives, our neighbors and our families, and what that does. And we're going to do everything that we can within our power to support the people and the business. But with that, I just want to make sure that we're healthy and safe, and I wish that for you and your family and your team of employees as well. Thank you.
Thank you. Vice Mayor?
I have no issue with letting businesses put out some extra temporary signage. I think it's fair. So if businesses want to do that, I think we should allow them to do that. We can tailor it to coincide with the governor's order for now. And then if the governor extends it, we can have an extension, I think. I think that would be fair. And I do like the idea of having a place where people can go if they do want to get takeout or have delivery, just to have a list there. And I think that would be great to share and to help our businesses out for people who want to do the takeout. I know I've been participating in takeout, and we'll continue to do so. But it's great to have one place where people can look and say, hey, I can go to this place and get whatever food I want or what I need.
Thank you, Vice Mayor. So I think it was underscored by Deb, but Russ and his team, Elijah, I believe they've already gone to the holiday temporary sign program, use the same communications pieces, et cetera. So you've already taken that action as our incident commander, right, sir?
That's correct.
Right.
Yes.
And so what I would say, Deb, is that every business that is open now, like you, after midnight, is an essential business. And so we should treat all of you openly and from customer service oriented, trying to find ways to help you, but we should try to help all of you equally, because all the businesses that are going to be open now are essential businesses. And so it's important for us to have that standard. And I think we do have the temporary signage standard. We have a great graphics package. I do like your point, though, and it's one that I have. So your question about where do you find the stores that are open, right now you find it at www.cityofportstlucie.com/COVID-19. And then when you get to that landing page, you have to go under the supplies tab at the bottom. It's not the easiest to find. So we have an awards-winning communications department. I'd ask them if there's a better way to do that. How might we make that more friendly? Maybe it has its own breakout landing page. And in addition to the grocers, pharmacies, and convenience stores that are on there now, then maybe we can link to that great one that shows all of our local businesses and restaurants that provide takeout service. There's no question that we're safe in the city of Port St. Lucie, relatively speaking, even in a pandemic. That being said, I want to encourage people, and I don't know if your business offers delivery service through Grubhub or any of the other providers, but I'm going to continue to encourage people to use delivery, or if they must personally go out, to have one person go out, and that, because our kids, you know, I have very responsible children. I have a 19-year-old, an 18-year-old, and a 16-year-old at home, and they go out and get stuff, but hey, bring wipes with you, wash the debit card down, stay away from the person giving you the food, maybe give the bag, if it has a handle, make sure you get it with the wipe. When you get into the car, use if you're not carrying a jug of soapy water with you and wash in the parking lot, then use your hand sanitizer that has at least how much? 60% alcohol? And make sure you rub it till it's dry. I mean, and then when you get home, take your shoes off at the door, wash your hands for 20 seconds. I mean, these are the procedures that you should follow if you want to go out and come back and be safe, right? Mm-hmm. So all for supporting you, Deb, and our local restaurants and order and take out as much as possible. Do you have an online menu?
Not interactive like most. So unfortunately, our menu is evolving too. Not a lot of people want to order steaks to go.
So how, and you're not on the record, I will be on the record. So,
We take a picture of our temporary menu and send it right to the home.
okay, and what's the name of your restaurant again? All right, so anyone out there, we have a Buffalo Chop House in the house here at City Hall. They are open. They would love to serve you lunch or just dinner. They would love to serve you lunch and or dinner. They would like to serve you both. You can call and see what their specials are and have pick up or maybe arrange for delivery.
Mayor?
All right. Yes.
And they're on Gatlin Boulevard,
On Gatlin.
in my district.
Right off of PSL, right around the corner. You can go there and Aldi at the same trip, so you don't have to go out more than once.
And their Wagyu burger is really, really good.
All right. And you have hopefully they still have that in stock. All right. Any responses to public to be heard from Councilwoman Morgan or Dr. Carvelli?
Yes.
No.
No. Councilwoman Morgan? Yes, you have a response, or yes, you were just answering?
You froze up on this side. I can see it's frozen.
She's frozen. Like Elsa, let it go, frozen?
There.
Yes, there you are.
Yeah, it was. Okay. Am I on?
You're on, ma'am.
Goodbye.
All right. In regards to Deb, thank you so much for bringing that out. And I guess the advantage of being at home, not really an advantage. I'd rather be there in person, but we all know why. On our website, kudos to our communications. And I scrolled down to the food assistance. And right there is carry out and delivery restaurants, treasurecoastrestaurants.com. So a suggestion, because there's not a lot of Port St. Lucie restaurants that are listed on there. This is, from what I can see, a free service. And it shows all of delivery, pickup, curbside. So again, it's on our website, cityofpsl.com/COVID-19 under food assistance, and it's treasurecoastrestaurants.com, and it'll take you straight to that link. So in response to that, I'm glad that we are relaxing the sign ordinance for businesses. And just a shout out for Deb also. And I didn't get a chance to do it yesterday, but I'm looking forward to next Wednesday if you still have the Wacky Wednesday days. So thank you for that. And I will reserve the comments, I guess, when we're finished with public hearing. I do have some more comments. Thank you.
Thank you, ma'am. All right, anything else on response to public to be heard? No, then we will go to closing comments. Go ahead, Councilwoman Morgan.
Okay, just a few things. Thank you for today. Thank you to everybody that participated. City Manager, Mr. Blackburn, you're doing a tremendous job as our Commander-in-Chief, and I appreciate all that you and your staff are doing. To Chief Bolduc, thanks for answering my calls and my questions when I get questions from people in the neighborhood. So I appreciate everything that everybody's doing on the first line. And to Jim, great information. I agree. We want people to research and read the order and read the information, not give legal advice. Don't want to wind up having to deal with it at a later time. while we were online and the governor came across, I did get the link and I pushed on it, did not listen to it. I was trying to read the closed captioning as fast as I could. He did take responsibility and understands the response for the unemployment. He is adding staff and they're working to upgrade the website. They will take paper applications. They're asking for patience, 1 to 2 weeks while they do all this upgrade. And that's part of the piece. It's just be patient. It's going to happen. It will work out. It also came across about a question was asked in regards to the capacity at businesses. And I know that you had brought that up. He had mentioned something about 25% of the capacity. It scrolled so fast, I didn't catch the entire thing, so we may want to look at that. My suggestion would be let's work with the county on doing something like that. I did go to the store. Publix has got all the blue lines mapped out. They've got their plexiglass in place. There's going to be minimum contact, obviously, picking up prescriptions, paying for your orders. So just be safe and use your hand sanitizers and your wipes. He also did state that they are suspending all foreclosures and evictions for 45 days at this point in time. And so I'm sure that'll change. But you had mentioned evictions earlier, so I wanted to put that out there.
That's great news. Thank you.
Yes, that is good.
And restaurants, again, pickup, delivery, they do curbside. Let's be responsible and read the order, and especially from Homeland Security, of what is essential. So the construction world is still going on. They're continuing the houses. I know there's road work going on. It's just be safe and abide by the CDC safe social distancing of the 6 feet. But take care and hope to see y'all soon.
Thank you, ma'am. We see you right now and you look great. And you just gave good advice. I don't think it was legal advice, but as a community leader, you gave guidance that construction was going to continue and that infrastructure work was going to continue. And I think both of those things are accurate, at least in my personal reading of the order. So thank you for sharing that. And I think that's the kind of information we have to continue to share to our residents. Thank you so much for all that you do,
Thanks.
Councilwoman. Dr. Carvelli?
Yeah, I'll be brief. I think that I hope my suggestion to create a scrolling PowerPoint was not lost. And Mr. Blackburn, I hope you move forward with that. It'll be another avenue for notifying the community with the questions and answer, frequently asked questions, however you want to word it. I think it's very important when we're in a state of crisis that we have a single voice. Mr. Blackburn, you've been given authority as our emergency management leader. So, keeping that single voice there is critical. It avoids confusion. And I always remember in a crisis that people are always looking to the leaders for calm, focused leadership who have a plan. We're there, we're all together, and their actions usually follow. There's nothing chaotic happening. We're responding well. I could point to other places around the country and listen to some of the leadership. They fumbled the ball a whole bunch of times, and they were blaming people in this. We're taking ownership to our city, and we're taking ownership to helping our residents, and that's what matters. We set the tone for our citizens. Otherwise, that's all I have to say. I hope everyone's safe and utilizing those practices. I can tell you from being out in St. Lucie West and on the other side of Bayshore and on US 1 and a lot of the stores, everybody's talking about this. They're taking it seriously. There is a lot of stockpiling of food and supplies going on. If you read between the lines of how these things take off around the world that I've been reading, having that and being able to stay at your house and hunker down for a few weeks will be very critical. So that's all I have to say. I hope everyone else is doing okay. And Mr. Stokes, thank you too for the update. That's all.
Thank you, Dr. Carvelli. Councilwoman Carballo?
Again, thank you to the city manager and team for your continued hard work and efforts during this pandemic. And she said Wacky Wednesdays. The beef on Weck, too, is probably my top favorite. Sorry, I had to add that in. I wanted to also mention that in the governor's briefing, I think it was yesterday, Mayor, and I'm sure you probably heard this too, that he's opening up about $2.1 billion for infrastructure. And he's going to be advancing infrastructure projects through FDOT. And so I just wanted to make sure that the manager knew about it, but I'm sure he did. Just because he mentioned the decrease in the road capacity, so this would be the opportunity that the state would have to hopefully advance projects that they've been waiting to do. So that's going to be some positive stuff, and also to help with the ever-changing lifestyle and hopefully give some relief financially to those individuals that need to work.
Can I piggyback on that before
Sure.
we continue? So I did listen to it. I take notes. I always watch the governor's press conference every day, and I was excited. But then he went on to name the actual projects that add up to $2.1 billion. So we would like for him to authorize or the legislature authorize additional expenditures or that magical fourth federal bill to come through that funds infrastructure so that shovel-ready projects could get in the ground. But unfortunately, all those projects he mentioned in Miami-Dade, Orlando, and then Tampa, St. Pete, added up to $2.1 billion.
Yeah. He said Sand Lake, but I was going down the lines with what you were going with, that we do have projects here that FDOT we're working with. So I'm encouraging staff to reach out to see if we could work on getting those advanced. We have people in the organization that I don't see often, like Bill May is one of those guys that I don't see very often, but he always reaches out to everybody every single day with a message. And today's message was hope. And it spoke to me, and it says, if you only carry one thing throughout your entire life, let it be hope. Let it be hope that better things are always ahead. Let it be hope that you can get through even the toughest times. Let it be hope that you are stronger than any challenge that comes your way. Let it be hope that you are exactly where you're meant to be right now, and that you are on the path to where you're meant to be, because during these times, hope will be the very thing that carries you through. And that was from Nikki Banis. And I want to thank people like Bill May who send out these great messages to continue to give us hope during the tough times. And I'll close with that. Thank you, Council, and it's nice to actually see you guys in the flesh, even though I can't hug you and do my normal customary greetings.
Thank you, ma'am, and thank you for your message of hope. Vice Mayor?
Yeah, thank you, Mayor. I just want to send a message to everyone to continue to take this very seriously so we can get through this difficult time, and also make sure that, you know, you're doing the right thing with only going out for essential services, and that if you do come in contact with one of our officers, please comply, please do what they ask you to do, because this is to benefit all of us, the health, safety, and welfare of our entire community. I want to thank our city manager and city attorney and our whole team for, you know, dealing with this ever-changing way of life that we are in now and doing it so well. I appreciate all of your efforts. I appreciate the chief taking my calls as well to answer some of these questions that I just don't have the answers to. That's been great. And, you know, as a city team and a city council, I know we're going to continue working for you and keep doing what you're doing and evolving to these changes that are happening so rapidly. And I really do appreciate the situational awareness updates that we're getting. When I read through them, they are very helpful, and they do help me to be able to answer questions that I have received from our citizens. So seeing those every day has been great, and I look forward to continue seeing those happening. And that's about it. I just want everyone to be safe and healthy and do the best you can and think about your neighbors. Thank you.
Thank you, Vice Mayor. I want to echo your sentiment of thanks and your expression of thanks to everyone. I want to thank you, Vice Mayor. I want to thank you, Councilwoman Carballo, Dr. Carvelli, Councilwoman Morgan, Mr. Blackburn, Mr. Stokes, the Chief, Avi, everyone in this room, Melanie, Deb, everyone, the press. I want to thank George and all the members of our press and our television stations. I want to thank everyone who is working so hard to win this war against COVID-19. Thank you to Team PSL everyone putting themselves in harm's way, so that we may get through this. So we might get through this faster. We will get through it. But if we get through it faster, it's going to be because of everyone's hard work. I want to thank our nurses, doctors, healthcare professionals, first responders, truck drivers, essential service providers, retail employees, warehouse employees, farmers, faith leaders, gas station operators, teachers, and everyone else who's working hard to get our community, country, and world through this crisis. Everyone who's been finding creative ways to thank our healthcare workers, first responders, and frontline essential workers for their tireless work and sacrifice. This evening, I have a blue ribbon tied around my neck. At home, we have a blue ribbon on our mailbox. I'm calling on all of us to follow the trend that's been started in the lowlands of South Carolina and other places where we put blue ribbon on those places, on our mailbox, on our front porch, around our trees, to recognize the hard work, the tireless efforts, the sacrifice of our healthcare employees, our first responders, and our frontline essential service workers. That's that group that I just read off. Please find a way, get it delivered through Amazon or Walmart Direct or your favorite retailer. Get some blue ribbon delivered to the house and put those ribbons up. In fact, like me, you might not have blue ribbon at the moment, so you might have cut blue handles off of a reusable shopping bag and use those to make some simple loops. But however you do it, please do it. There are people going to the hospitals in their cars, properly socially distanced, contained as a household unit, having their signs up, flashing their lights, honking their horns, showering our healthcare and other heroes with love and support. And I'm going to tell you, and I've heard it right from the front lines, that helps those professionals keep going. So sometimes little gestures aren't so little. They can be a really big deal. And rumor has it that 7 to 7:30 p.m. is a good time to have a parade of appreciation. Of course, again, in your cars, safely, to express our appreciation around the local hospitals. I want to express my pride in my stepson, Eric, who's working in a major hospital in Tampa without proper PPE in service to others. Be careful, Bubba. I want to thank my wife and Alex, Christian, and Peanut for always being there for me so that I can be there for you and our community. And of course, I want to thank all the people of Port St. Lucie who are being informed, prepared, and committed to stopping the spread of COVID-19 in America. And in closing, let me say, please, people of Port St. Lucie, stay home unless it is, quote unquote, essential for you to leave. If you would do that, if you would use that tool available to us, we can reduce hospitalizations of our fellow citizens. We can save lives. We can keep our we can keep as many people as possible who are in that population of 45,000 plus seniors, an unknown number of immunocompromised, and all the rest of us from harm's way. And we will get through this crisis. We are responding. The better we respond, the sooner we get to the recovery and to whatever our new normal is. And the sooner we can get to the recovery, the sooner we can prosper. And that will happen by us working hard, smart, and together. Thank you, everybody. Anything else?
Can we light the city up in blue, the City Hall building?
Yeah, do we have the ability to light it up blue? Great suggestion. Good job.
Maybe we can
Just
ask
gave me goosebumps.
TAMCO to do the same.
Yes, let's reach out to Frank and our friends at TAMCO. Great job, guys. Good suggestions. Great suggestions. Well, you got any other good ideas before we close?
I'll send them to the manager, like we talked about.
Okay. But all right, so just to have, I know this is, when you think about the death and everything, it's very somber, but in these moments of crisis, we are still working and being a team and a family. And this is good work that we're doing. So just in a moment of lightness, TP is a real problem. Mario Cassetti of Inside Out Cleaning, he reached out to me and said, "Hey, Greg, it's not the best, but 2-ply, it's commercial. I have some toilet paper." I said, "All right, I will pay you cost." So for $50, got 96 rolls. That is our strategic toilet paper strategic reserve. It is in the extra office in the council room. And what I would say, in all seriousness, we have to find ways to help. And here's an example with this very basic need, right? This most essential of needs. We have to be there for the people. So if you are a senior or you're a low to mod income person that you have not been able to find TP and you're desperate, please email bdolan@cityofpsl.com, BDOLAN@cityofpsl.com. We will review your request and get you help. We will use that strategic toilet paper reserve. Did you ever think we would end a council meeting with that?
Never.
No.
Nope.
What?
Those are the times that we're in. There is no, a good friend of mine once said, Greg, in local government, there are no small issues. And there are some basic issues, some essential issues, but there are no small issues. We're going to help our residents every way we can. Anything else? Yes, ma'am.
And if someone, I would say too, if someone wants to coordinate, if they have donations similar to that they would be willing to donate, wouldn't they be able to come, like, or call?
Oh, yeah, they could just reach out to one of us and
Yeah.
we'll make it happen, just like we did with Mario. All right. This meeting's adjourned. Thank you, everybody.